Thank you, Roy.
Thanks. Okay.
Good afternoon. I'd like to welcome everyone to the fifth and final meeting of the President's Commission on Combating Drug Addiction and the Opioid Crisis. At today's meeting, we will hear from members of the public who will share their personal stories on how opioid addiction has affected their lives and their loved ones. The Commission will also be discussing and voting on its final report to the President. Members of the public can read a draft of the Commission's final report on the Commission's website at www.whitehouse.gov/ONDCP, and you'll see a page there for the Commission that should be posted certainly by the end of this meeting. On that website, you can also find the agenda for this meeting, minutes and videos of past meetings, and the Commission's interim report. The public is invited to submit written comments on the final report by emailing them to commission@ondcp.eop.gov. The Commission's final report has more than 50 detailed recommendations and is very substantive and useful. We in the federal government look forward to reviewing them and taking actions to try to stop the opioid crisis. I wish to thank Chairman Christie, Commissioners Cooper, Baker, Kennedy, Madras, Bondi, and their staffs for all their work in producing it. It's obvious from the quality of the product that a great deal of thought went into it. I'd especially like to thank Chairman Christie, his staff, and Commission member Bertha Madras for all the late nights they spent drafting and editing recommendations. I would also like to thank the dozens of Office of National Drug Control Policy staff who helped to draft, edit, and research many recommendations and background materials, provided logistical support for all 5 of the Commission's meetings, and handled and responded to the more than 13,000 messages from the public that the Commission received. In particular, I'd like to thank Richard Baum, the Executive Director of the Commission and Acting Director of ONDCP, for all of his work in coordinating the ONDCP staff. Thank you to Deputy Attorney General Rosenstein, Secretary Shulkin, Secretary Acosta, Secretary Carson, and other federal agency representatives for attending today and for all the very important work you will be doing to follow up on the Commission's recommendations. And finally, to all of you witnesses today here who are willing to share your personal stories, thank you for doing that, because by sharing these stories, you're personally helping to dispel the stigma around addiction so that people are more willing to seek help. And with that, I'll hand it over to Chairman Christie.
Michael, thank you very much. I'm going to forego any opening remarks right now. I'll make some remarks later on in light of the number of members of the Cabinet, the President's Cabinet we have here today, and they have some pressing matters to deal with in the afternoon. So I first want to thank all of them, obviously, for being here and turn it over to remarks to Secretary of Labor Acosta. Alex, I appreciate you being here again today as you were at the last meeting, and we look forward to your remarks. Turn it over to you.
Mr. Chairman, thank you, and thank you for accommodating a scheduling conflict that I have coming up. Let me say that first of all, I want to thank the Commission for the work it's done. This is a very, very important matter. It's an important matter for the nation and for the nation's workforce. The President has rightly declared the opioid crisis a public health emergency, and in that declaration, it's really a challenge not just to those of us in government, but to those of us around the nation to really step up and look at this issue in terms of what we can do, but also start to look at opioid addiction through a different light and really take steps to help individuals. Since the Commission meeting 2 weeks ago, I've spoken with several leaders of industry and labor. It focused me on the issue, and as I've met individuals, I've really asked them about this. And the response that I've gotten, the response I've received is really, I think, important to convey. To a person, the response was the same. This is a critically important issue. We are looking at this ourselves in our own organizations. This is something that we are hearing about. I spoke to one labor leader who told me that in one local in particular, they had lost 6 individuals, lost 6 lives because of opioid addiction. Leader after leader told me that this is a problem for their membership, for their business. Just yesterday, I met with Harold Scheitberger, who's the president of the International Association of Firefighters. And he said, I told him I'd be here today, and he said, please convey how much of an issue this is for us and for our memberships. This is something that we are acutely focused on and we are completely supportive of as first responders and as individuals that have membership throughout the United States in every single state. They combat the crisis in the course of their work as first responders. They combat the crisis among their own membership. And something that is particularly important is to convey that this is not something that individuals should be ashamed of admitting. This is something that just needs to be addressed. And so if there's a point that I spoke last time and I provided a lot of information about our own experience with the Office of Worker Compensation Programs and our own experience on the enforcement side. But I wanted to just stop by again today to convey that in just 2 weeks, every organization that I have spoken to about this has echoed the same mission. It's important, it needs to be addressed, and please convey that it's a problem individuals should not be ashamed of, but rather we need to support individuals in coming forward and dealing with this as a nation. And so thank you very much.
Secretary, thank you very much. And I think that you'll see, as you get a chance to look at the final report and the executive summary, that the Commission feels unequivocally about increasing the authority of your department to not only be able to levy penalties where appropriate, but also for you to be able to conduct investigations of insurance companies individually, not having to go through the employers. This is, something that I think is absolutely necessary. We sat here a few weeks ago and listened to the insurance companies, and we appreciated them being here. But I'll also tell you that when all of them are going around the table and saying everything's going fine and we're really making progress, and we have 175 people dying a day, I'm concerned about a disconnect. And the report makes that very, very clear. And we are urging Congress to amend the Parity Act to give you that authority. And I've told everyone, given how long we've known each other, that I am confident that if Secretary Acosta is given the authority, he will use it wisely, but aggressively. And so we are in your corner on this, and we thank you so much for taking the time today and appreciate it, and appreciate the fact that you're talking about it out there. It's very important. So do what you need to do. We understand you're real busy. You got lots of stuff going on, but we appreciate your time today, Alex. Thank you.
Thank you, Mr. Chairman.
Next, I want to go to another member of our panel today who has some pressing scheduling issues as well, but we appreciate him making the time. The Deputy Attorney General, Rosenstein. Rod, I'll turn it over to you for remarks, and thank you for being here.
Well, thank you, Governor, members of the Commission, and say special thanks to the family members of the victims who are here with us to share their experiences. And I want to assure all of you that you have no stronger partner in dealing with this epidemic than the United States Department of Justice. Our department is acting with great urgency and vigilance in response to the President's declaration of a public health emergency. Our department is relentlessly pursuing criminals who flood our streets with illegal opioid drugs. We have more than 1,000 active federal investigations involving heroin and fentanyl, and more than half of our highest priority cases are organized crime and drug enforcement task force cases. More than half of those cases are cases involving opioid drugs. We're focused on dismantling illegal drug distribution networks. On October 17th, the department announced for the first time charges against major Chinese fentanyl suppliers. We know the fentanyl is coming in one form or another from China. We also, just last week, announced the establishment of 6 new enforcement teams in the DEA to combat the flow of heroin and fentanyl in some of the states that are hardest hit by the epidemic. The department is committing resources to shut down internet drug dealers because a lot of our victims are ordering these drugs over the internet. On July 20th, the Attorney General announced the takedown of the largest criminal marketplace in illegal drugs. At least 122 vendors on that site were advertising fentanyl, and 238 were advertising heroin for sale through the mail. We also have committed additional resources to target medical providers who illegally abuse their prescribing authority by handing out opioids without appropriate medical need. In August, we created an opioid fraud and abuse detection unit to better use data to identify outlier providers, people who are clearly outside the norm in the extent of their opioid prescriptions. And we've assigned some of our most experienced prosecutors to focus on those cases. Our response to this crisis is not limited to prosecutions. The DEA uses its civil and administrative tools to fight the diversion of controlled substances. And DEA revokes hundreds of registrations each year, preventing reckless doctors and rogue businesses from exacerbating the crisis. Those are just a few examples of the department's commitment to curb the supply of lethal drugs, to punish criminals who exploit people suffering from addiction, and to prevent future addiction. I'm confident that the recommendations of this commission and the support that's generated by the president's order will turn the tide, that we will start to see a reduction in this horrifying upward trend of drug abuse and drug overdose deaths. I look forward to studying the thoughtful recommendations of the commission, and I want to thank you for your service in taking on this challenging task. Thank you.
Rod, thank you very much. Thank you for your assurances that the Department of Justice is with us on this. You will see there are a number of recommendations regarding enforcement in the report, and also a recommendation that there be a drug court in every one of the 93 federal districts across the country. It's an ambitious recommendation, but one that we think, given the success that has happened with drug courts across the states, would be a twofold benefit to the federal justice system. One, to get help to people who need it in order to slow down recidivism. And secondly, it will lower the federal prison population, which I think would allow us to spend those resources on things that I'm sure you and the Attorney General would rather do than putting people in prison who could otherwise be helped through a system like the drug court. So there's that and others, but we look forward to your reaction to it as well. And I can't thank you enough for taking the time to be here a second time. We appreciate it very, very much. Next, I'd like to go to the Secretary of Veterans Affairs. Dr. Shulkin has been here for all of our commission meetings. We appreciate that very much. We highlight, Dr. Shulkin, you should know in the report, the extraordinary work that's being done by the VA already on non-opioid treatments and the success that you're having, not just at the Lewis Stokes Center where we visited in Cleveland, but across the country, and suggest in the report that what the VA is doing can serve as a model for private healthcare providers across this country. And so your hard work and your passion about this issue is being evidenced in the results that you and your agency your department rather is beginning to show. So I'm happy to have you here, Mr. Secretary, and turn it over to you.
Well, thank you, Governor, and thank you for recognizing that because the department has been hard at work at this. I really want to thank the commission. I've truly been impressed and have learned a lot by watching the way that you've run this, Governor, and the way that the commission has brought in expertise from around the country and been open to ideas from almost every segment of the industry, and most importantly from the families and people who have been affected by this. So it's been a true honor to participate in this and to have watched this process, and we're very much looking forward to the report. There are a lot of commissions in Washington that end up with reports. I have a feeling that this report is going to make a real difference. And I also want to thank the President for his commitment and passion to this issue, because I know that that's genuine. I'd like to echo some of the comments of the other panelists so far. I think that one of the outcomes of this report is not only the content. You are getting visibility on this issue and getting people to talk about this around the country and getting all of us to be out there to talk about it. Governor, I don't know how many times I've seen you on TV in the last couple of days. I mean, you're getting out everywhere. That's really important. I think I was most impressed on your interview I saw on Morning Joe, because you were able to talk about the opioid crisis and baseball statistics, and somehow went seamlessly between both. And I don't know anyone else who could have pulled that off, but you really did. So I would just encourage everybody here to follow the Governor's lead on this and continue to talk about this issue, because that's the way which we're going to solve it. And I think all of the commission members have been doing a great job with that. Secondly, again, echoing some of the comments from Brad and Alex, this is making us all look internally. And while we at VA started our opioid safety initiative in 2010, we've been doing good work. This commission has made us refocus and look back and say, can we do more? And of course we can do more, and to do it more aggressively. So we're really refocusing our guidelines to make sure that everybody understands them and follows them. We are looking and going to relook at our approach towards naloxone kits, and now we're going to hear some more about that today. But we think we can do more, and it's really this commission that's helping us take a look at that. And we are going to redouble our efforts to make sure that we touch more people's lives and save lives. So thank you again for participating and for leading this.
Thank you, Mr. Secretary. I appreciate it very much. And your appreciation of my baseball knowledge is more touching than I can even tell you. Speaking of touching, I want to go next to the Secretary of Housing and Urban Development. I got to know Dr. Carson when we were both unsuccessfully challenging the president. And here we are, Ben. But I got to know Dr. Carson and his family during that period of time, and I think he might agree that it's one of those times when you really get to know people very, very well. You're exposed, you're working hard, you're under the same kinds of pressures, and what I got to know about Dr. Carson is that he has not only a great intellect, but he has a great sense of compassion for his fellow human beings, and that comes across every time you listen to him. And so I was thrilled when he said he was willing to be here today to speak on this personally. His department obviously is going to also have a great deal to do with dealing with the populations that we have to deal with in this crisis and making sure that it's dealt with in a way that's effective and efficient. So having Dr. Carson here today is not only a great personal pleasure for me to see him again, but it's also extraordinarily important for the perspective of the success of this endeavor that we're all going into together. So I turn it over to the Secretary of Housing and Urban Development, Dr. Carson.
Well, thank you so much, Governor, and thanks to President Trump, to other members of the task force for their continuing efforts on behalf of really a lot of people who are forgotten in our society. You know, I, even as a child, you know, had many encounters with the ravages of drugs, drug addiction. You know, members of my family, cousins who died because of it, people who got into severe legal trouble because of it. In the field of medicine, obviously encountering many people who were addicted to drugs, not because of my prescriptions, but just because it's so easy to manipulate the medical profession into giving you drugs. And a lot of times people, you know, doctors are people too, and they don't want to be bothered incessantly, so it's easier for them just to give you the drugs than to argue with you about the effects of the drug. But I was very pleased that the President declared this a public health emergency. And, you know, I think that brings the kind of attention that we need, because how many people really understand, you know, what 60 to 65,000 lives a year means? That's more people than were lost in the 19 years of the Vietnam War. And you see what a profound effect that war had on our society. So, you know, this really should be having the same kind of effect. But also, you know, from a neuroscience point of view, what drugs actually do to the human brain. You know, it's pretty awful. I probably remember that commercial back in the Reagan years when they said, this is your brain, and it was an egg, and this is your brain on drugs. They put it in a frying pan and watched it be destroyed. It's not too far from reality. And, you know, it frequently starts with something as seemingly innocent as marijuana. And I think we're going to probably hear a little bit more about that from a real brain marijuana expert. But, you know, we think a lot of things are harmless, and they're not. And when we look at the nexus between drug addiction and homelessness, it's pretty significant. And so many of those people under that bridge or, you know, sleeping out in the open are drug addicted individuals. We have to take care of those people. Sometimes there's a tendency to blame them and say it's their fault. I guarantee you 99% of those people, if they could push a button and be free of their addiction, they would wear that button out. They would be so happy. It doesn't work that way, unfortunately, because of the changes that occur in the brain. So it becomes important for us as a society to recognize these as people who are severely affected, to here, particularly the commission, particularly you, Chris, for taking on this task. And I think, as David said, it will make a big difference.
Thank you, Dr. Carson. Appreciate it. Next, I want to turn to the person who has been the point person for this commission and for the president on this issue inside the White House, the counselor to the president, Kellyanne Conway.
Thank you very much, Mr. Chairman. I'm really here today to say thank you once and for all to this commission. It's been a huge priority for the president, really from the very beginning. And as witnessed last week in his very powerful address to the nation, he intends this to be a coordinated effort among federal, state, and local governments, non-government organizations, individuals. And I think much of the behind-the-scenes work that this commission has done has gone unrecognized and unappreciated by the general public because it's been such a quiet effort most times. And I'd like to thank all the members of your commission, Mr. Chairman, and to thank Michael Passante, and also to add my thanks to the acting director of the ONDCP, Rich Baum. As you see evidence today in front of you and through the president's remarks last week, this intends to be a full administration-wide effort in combating drug demand, drug addiction, drug supply, frankly, and the opioid crisis. Right after the president took historic steps to address this issue full square, and also did so in a very specific policy-laden way with his wife, our great First Lady, Melania Trump, I think the country heard a call to action for each of us, and recognizing that the problem does affect each of us in some way, some of us more deeply than others, that the solution also has to include each of us. And in that regard, I wanted to just say we obviously have received, Mr. Chairman, the attention of many people in Congress. But in addition to that, I think most importantly, the very next day, the Department of Health and Human Services released a clarification of the HIPAA laws, guidance to healthcare providers, so they may be able to share with family members if a loved one is already suffering from misuse and disorder. And I think that's incredibly important because we have heard many stories here in the White House and all around this country, as you all have, of families who say, we're so sorry, Mr. and Mrs. Jones, that your son has passed away today. We resuscitated him. We helped him 6 times this calendar year, but the 7th time he was too far gone. And Mr. and Mrs. Jones say who, what, when, they have no idea. And so to the extent that that HHS has made some clarifications, and that can bring some relief, it's a positive step forward. Today, the Centers for Medicare and Medicaid Services will announce an IMD waiver for each of 2 states, New Jersey and Utah. And the president addressed the waivers last week in his remarks as well. Our position is that the number of beds in a facility should never negatively impact the number of patients who could be treated. And when the public hears about that regulation, it just strikes them as one of many that seems unfair and unseemly and unnecessary. So we're very happy to be taking steps in that regard as well. A market improvement on all these fronts really needs something else the president has made a priority, which is a massive education, information, small C campaign across the country so that everyone knows how best to meet these challenges. We must engage and maybe even enrage the public so that folks who have never tried these drugs don't start in the first place. We certainly want to help those who are already suffering, and we want to remove the stigma of addiction and help these individuals to access treatment and begin the process of recovery. This is a complex issue with no easy answer, yet it is a worthwhile undertaking. And I think the work of this commission, which, Mr. Chairman, we look forward to reviewing in full in the coming days and weeks, and we'll rely upon everybody here to help us implement some of those recommendations. It's exactly why we're all here today, so thank you very much.
Thank you, Kellyanne. I appreciate it very much. And I do think, as you mentioned in your remarks, that the event the president hosted in the East Room last week was extraordinary. And when you look at the cross-section of Americans who were in that room and represented and heard the president's words, I've said to folks over and over again across the country that I've spoken to the president about this dozens and dozens of times, and I know his heart, and I know how much he cares about this. And I think last week everybody who watched that speech got to understand exactly what I meant. And so thank you for making that happen. And we as always thank the president for his willingness to do it. We're lucky to have the Surgeon General with us today as well. Welcome. We appreciate it. Appreciate you being here before. And I want to give you an opportunity from the perspective of the Surgeon General. We've had some good conversations offline. I'd love to have the Commission hear your remarks regarding our work and the crisis as you see it from the seat of the Surgeon General.
Well, thank you very much, Governor Christie, and members of the Commission for having me here today. I'm honored to be here on behalf of Acting Secretary Hargan and the Department of Health and Human Services, where we've been working tirelessly to combat the opioid epidemic. This epidemic, and make no mistake, it is an epidemic, has had a profound impact on my life and my career, and as such, this is an extremely personal issue for me, as I've shared with some of the folks in this room already. As a practicing physician anesthesiologist who has done acute and chronic pain management, who has prescribed fentanyl, who has prescribed Narcan to folks, and as a public health professional, I've watched this crisis evolve and spiral out of control on the front lines. In addition, I've publicly discussed my brother's own battle with opioid addiction. I've experienced the pain and the struggle that families face as loved ones combat addiction. Justin and I have cried together talking about her son who passed away from an overdose, and my brother who sits in prison right now because of untreated substance use disorder, and how we can share our stories to help make a difference. Yes, we cry together. Yes, we wish it had been different, but we're determined to use these as an opportunity, these stories as an opportunity to lower stigma and to make a difference for everyone else out there. And I think it's important also as we talk about these numbers, and we need to talk about how big the numbers are, but we need to remember that these numbers represent individuals. I talked to Doug about his daughter Courtney, and I want to thank all of you all for being willing to come and share those stories of those individuals, because that's why it matters. It matters because of the individuals who are suffering. We know the only way to end the opioid crisis is through coordinated efforts across the entirety of communities. During my time as Indiana State Health Commissioner, we faced one of the largest HIV outbreaks the nation has ever seen as a result of injection drug use. We were able to stop the spread of disease and prevent an increase in illicit opioid use by bringing together not just state, local, and federal government, but also law enforcement. And that's why I was so glad you put DOJ on one side of me, the business community. I'm glad you put labor on the other side of me, even though they ran. I don't know where they went. I put on deodorant today, I promise. But I saw that those collaborations across different sectors and different areas of expertise is the only way to succeed. Government, make no mistake about it, needs to help, but cannot do it alone. It's going to take all of us coming together. This administration, and I'm very proud of the president, and I'm so glad that you mentioned last week. I've done interviews too, Governor Christie. Politics aside, it's a powerful thing when the President of the United States shares his personal story about how he and his family dealt with addiction. It's a powerful thing when people come forward and share their stories, and I couldn't agree with you more. I think last week was a turning point. This administration demonstrated its commitment to successfully attacking the opioid crisis in a holistic manner by following the ethos that I subscribe to of better health through better partnerships, and by convening this commission with experts across various sectors and incorporating their expertise into your recommendations. At HHS, we've worked diligently to incorporate the recommendations of your interim report, and up until last week, we had successfully made progress on every single one of those recommendations except the emergency, and glad we were finally able to get to that place. Thank you again very much. Into our 5-point plan that we have at HHS. Last week's the President's memorandum and Secretary Hargan's subsequent declaration of the epidemic as a nationwide public health emergency caused me to then go out immediately, the very next day, and visit Phoenix House Recovery Center in Northern Virginia, where I got to speak with substance abuse experts and many individuals in treatment. And they were happy. They were pleased that the President said what he said. They said, thank goodness. Finally, people are starting to pay attention and looking at this as a disease and not as a moral failing. The interaction at Phoenix House that impacted me the most was a meeting with a young lady who was in her 20s, who was an honor student on her way to getting her master's degree, got pregnant, went down the rabbit hole of addiction, and ultimately had a baby who she was worried about being born addicted to substances. Got into Phoenix House and was actually able to recover, and her baby is fine right now. But not only the stories where it didn't go right, but it's important we share the stories of recovery and help folks know that recovery is possible. That story really deeply affected me as a physician and, again, as someone who has seen many people in my career who could have gone down that path. Seeing the joy on her face, her hope, and her new sense of control over her life renewed my vigor for tackling this crisis head on. We must remain dedicated in our efforts, and the work of this commission has been instrumental in guiding and coordinating the response across federal government. We look forward at HHS, I look forward as the Surgeon General to hearing the recommendations that are put forth in your final report today, and I'm eager. Can you tell? Can you hear it in my voice? I'm eager to continue this very important work. So thank you for the opportunity to be here, Governor.
Thank you so much for your hard work and the hard work that I know you're going to put forward in the months and years ahead. It is inspirational to have someone like you in this position, and we're thrilled that you're there and that you bring the life experiences that you bring to this. It's going to help make you a more effective Surgeon General, I am confident, and it's going to help the nation by having you there. So thank you very much for being there. I want to turn now to our invited guests. We'll have time at the end for each one of the commission members to speak about their views on this issue and on the report, and to make a final vote as well. But I really want to get to our invited guests. I first want to go to Congresswoman Mary Bono. She served in the House of Representatives from 1998 to 2013. And we have had the opportunity over the years to talk about this issue, and I'm thrilled that Mary was able and willing to come, and I will turn the microphone, Mary, over to you.
Thank you very much, Governor. I feel like I should start my remarks with, hi, I'm Mary, and I'm in long-term recovery as a codependent. But I want to just thank you all very much for having me today, and it's a real pleasure to see, especially my former colleague, Patrick Kennedy. I thank you all for giving your time, your efforts, and your hearts to sparing more Americans from the suffering of opioid use disorder and all that that means. For anyone in public life, few causes offer more direct opportunity to bring hope where there is despair. It's a story of grief and loss that so many families have known. But at least as a nation, we are finally waking up to the gravity of the crisis facing us. And that is a credit to the work of this commission and to the President whose mandate you are carrying out. But I can't begin my remarks, Governor Christie, without recalling your very powerful and passionate words at a town hall meeting 2 years ago. It was just a brilliant speech. You spoke of a law school friend who never found a way out of an opioid addiction. You know firsthand how it feels to see the gifts of someone you care so deeply about go to waste in a very avoidable tragedy. You and your fellow commissioners bring great compassion and knowledge to the subject. And compassion, above all, is needed if we are going to understand the danger of opioid misuse, and as a country, that we overcome it. So I learned early in my life that addressing addiction begins with understanding and empathy. I was blessed to have a very wise father who is also a professor of medicine at the University of Southern California. My mother was an alcoholic, and my dad taught me to see any substance use disorder as a disease, not to judge it as a fault of character. And I learned that addiction can afflict anyone. And sadly, I learned that again when I had children. Certainly with powerful opioids in the wrong hands, it is a recipe for disaster. So some of you may know, maybe you don't know, but I have a son who is now 29 years old. He's an amazing, kind, and courageous person, and I couldn't be more proud to call him my son. But one day when he was a teenager, he called me. I was here on the floor, actually, of the Congress taking votes, and I took his call, and he said, "Mom, I need help. I'm addicted to pain pills." Now, that's not the kind of call a mother ever wants to get, and yet I was so thankful that it came. As many parents know, it's when you don't get that call, and you never then have that chance to help, and then the worst can happen. That moment, hearing from my son, was hardly the end of our struggles and our fears, but from then on, we were able to face them together. The courage was all his, but what a difference it made that my brave son had our support and felt our love, rather than shame, anger, or stigma. So far from feeling any embarrassment as a member of Congress, I could have been ashamed of the situation. I never felt embarrassed, and I didn't feel any stigma about our family's troubles. Some of that probably goes to Patrick's leadership, too. But I realized I've been given an opportunity, and that opportunity became my cause and my passion. So as a member of Congress at the time, and I tried to use that position for the better, my son and I spoke publicly about the dangers of prescription drug abuse and the path towards recovery. And the more identified I became with the issue of opioid addiction, the more I learned from others about its consequences all across America. Now, there's no way to prepare a family for its own opioid crisis. Many parents-to-be know the book What to Expect When You're Expecting. But of course, there's no similar guide on how to help a son or a daughter confronting an opioid use disorder. But here's one thing I know for sure. Excuse me. If anything good is going to happen for our loved ones in need of help, it's going to happen in treatment. Only there, in professional care, are they no longer powerless. And by the way, it's where the family is going to get the help they need too. But we don't have to wait for those we love to fall to the very bottom before help is possible. Sometimes the bottom isn't just the bottom, it's actually the end. So in every way we know, being as resourceful and relentless as we can, the goal should be to move the person to that life-saving decision when there's still time, and never, ever, when that magic moment occurs that somebody wants to seek treatment, should they ever be turned away for any reason at all. So for my part, I spend a lot of time in this cause still, and my purpose is very simple to state. I want as many people as possible to escape addiction in the way that my son is doing, by the constant caring support of their families, their friends, their coworkers, and their communities. And as to public policy, by now there's little debate about what has gone wrong, a lack of congressional oversight, many failures of responsibility among various federal agencies. These have all been contributing factors to a very terrible epidemic. But what matters most going forward is the alertness and the decisiveness that this presidential commission represents. And as you help to correct past failures in policy, it will be crucial as well to avoid new ones. A truly national effort will need sustained and adequate funding, and a commitment to best practices that, for example, protects the vulnerable from the scammers that we're now seeing who are popping up in the treatment sector, what we're calling the dark side of treatment. And most important of all, the effort must center on preventing the disease of addiction from ever taking hold in the first place. In the painful journey of addiction, the crucial turn often comes in one clear look at where it's all leading, instead working towards a path of hope in life. Something similar happens when a society looks at a grievous problem straight on. It brings the best minds to address it and commits everything possible to solve it. That's what the United States is doing with this presidential commission, meeting a serious challenge in a very serious way. May your recommendations be turned into law and policy, and may our resolve as a nation be turned into action. Countless lives depend on it. Mr. Chairman, thank you again very much, and I thank you all for your time and your hard work.
Mary, thank you very much. You have been a clear and strong voice on this issue and sharing your story today. And that's really what we want the Commission's final hearing to be. Because in the end, the work of this Commission is about the lives that are lost and the lives that we hope we can save. That's why I thought this was the most appropriate way to do it. And I wouldn't have wanted anybody else to start off those conversations other than you. So, Mary, thank you.
Well, thank you very much. I'm honored. Thank you.
Next, we have Judge Linda Davis, who has also been a leader in this area. We're thrilled to have Judge Davis here. She's from Michigan, the District Court in Michigan. And Your Honor, it's good to have you here, and we look forward to your remarks.
Governor Christie and Commission, thank you so much for having me today. My journey with this started almost 13 years ago. I have a young daughter who was addicted to opiates. And I found out, even though I had worked in a system, I was the drug prosecutor for 13 years in our county. I've been a judge for 17 years. I ran a drug court. It was amazing to me how little I knew about how to get somebody help when they really needed it. And I want to focus mainly on the brokenness of the system and the hope that you are giving to parents like me and the other parents that are here today. Back when I started my journey, every door I tried to open was closed, and if it had not been for the fact that I come from a pretty affluent family that had resources, I'm sure that my daughter would not have survived the addiction. It's horrible when a parent is watching on a day-to-day basis their child die, and there's absolutely no resources that you can turn to get help. In addition to that, the stigma of addiction is something that not only she's felt, but I've also felt. And it reminded me of how broken the system is and how much we need to look at almost every facet of it to make sure that we are looking at this comprehensively. As a result, and when she was in treatment, I remember one of her counselors telling me, someday you're going to look back at this and realize that it's a blessing in your life. And I thought that person must have been high on drugs, because I couldn't imagine that this would ever be a blessing in my life, but it truly has been. It's not only made her a better person, but it's also made me a better person, a better judge, a better mother, and a better member of our community. I started an organization very soon after finding out that she was addicted, called Families Against Narcotics. We started in the basement of a small church, and now we are here in Washington, D.C., being part of a very important discussion. We went from a very small community effort into having over 20 chapters in the state of Michigan, 27 meetings that are held monthly. We work with 4 major hospitals, have partnered with Blue Cross Blue Shield, have partnered with the University of Michigan research team in developing new educational protocols that can be used in our schools that will bring a different approach to teaching kids about drug use and abuse. We oftentimes want to badmouth efforts that have been made in the area of education and say that they don't work, like the DARE program. But what we've failed to do in our country is to have a continuum of care with not only those people that are addicted, but also with those people who are making those important decisions of whether to cross lines that they once knew were bad lines to cross, but somehow with turning into teenagers, they forget those lines and they experiment with things that can end up being deadly. So when we do education for children, we need to make sure that it's a continuum of education, that it starts young, and that we are relentless in giving the same messages over and over again to make sure that those messages are heard. We as politicians know that you've got to get the same message out 7 times before we make an impact in our communities. The same has to be true with addiction. I think one of the biggest areas that we need to really focus on are ways that we can get out into the community to talk about this being a disease rather than a moral failing. It amazes me, we started a program recently through Families Against Narcotics called Hope Not Handcuffs, where we are now partnering with 33 police departments in our state, over 5 counties, and since February we have placed over 600 people successfully into recovery the same day. And that's a key issue, because nobody should be told that they have to wait 2 weeks for recovery to start. Sometimes those 2 weeks are the gap that creates a deadly situation for that young person. So I look forward to this commission making changes that will ensure that when someone walks through one of those police doors, that that day a treatment bed is available to them. And not only that a treatment bed, but that solid treatment is available, and that we have wraparound services where we look at peer coaching as a viable option to being an aftercare for people who are in the recovery world. That we make sure that we have medically assisted treatment that's being paid for by insurance companies for those that can't just get clean with a 12-step program, that there are viable treatment options. We tell people over and over again that are in the world of addiction that if you want different results, you have to do different things. Otherwise, you're just going to get the same results. And yet we work in a community that has done the same thing for decades with addiction, and unfortunately, it has taken an epidemic of unbelievable magnitude to get our attention that we need to change at every step of the way as well, from law enforcement to the judicial system to what Congress is doing, to passing laws that we don't understand, that we don't know the meat of them, and the effect that they're going to have long term. Our group has taken on the task of also educating all of our legislators so that when we present the 25 bills that our commission is putting before them, that they understand the necessity of those laws and the impact that it can make in our community. And we do that through education. Tomorrow morning I'm flying back to Michigan, and we are doing an all-day legislative day where we tackle this problem at every step of the way so that our legislators can vote intelligently about the bills that are before them. The one thing that I've learned over the last 13 years in dealing with this epidemic is that we are broken at every step of the way, and it is going to take all of us working together as a concerted effort to make sure that we are doing the best job that we can every step of the way. In our community, we started an organization called Operation RX through FAN that brought every sector of the community together that's being touched by addiction so that we leave no gaps in our community. And that's one of the key issues for this, is that we can administer Narcan and that child can be taken to a hospital. But if all they're going to do is detox and then put them right back out in the community again, we have failed. Even though we have gotten Narcan in every first responder, that person should have a chance at recovery from that moment forward, and we should be relentless until we get them to that point. So it is with a great honor that I'm here today, and I'm really looking forward to learning your recommendations and seeing how this pans out in our community to make a difference for a disease that has been left behind and left out for way too many years. Thank you.
Thank you, Your Honor. Appreciate your remarks and all the work that you're doing as well. Thank you for that. Next, I want to invite to speak Roxana Schwartz. She is from my home state of New Jersey, Lebanon, New Jersey. Welcome, and I turn the microphone over to you.
Thank you very much. I don't want you to be concerned that this is my testimony, but it is my current insurance appeal. My name is Roxanne Schwartz. A lot of people know me as Rocky. I live in Lebanon, the great state of New Jersey. I want to thank Governor Christie and the members of the commission for inviting me here today. I especially want to thank Congressman Kennedy for creating the parity registry, because it has been a great tool for me. I'm very grateful to be here and hope that other families will not have to struggle getting medical care for their loved ones like my family has. I'm a member of the New Jersey Parity Coalition, and I'm the co-chair of the New Jersey Behavioral Health Planning Council. But most importantly, I'm the proud mom of 2 sons who are remarkable and resilient young men
Company finds a way
who have suffered with substance abuse and mental health disorders for the past 7 years. My husband Keith could not be with me today, but I would not be here without his loving support. My sister died of an accidental overdose at the age of 39 from opioids. And I am a woman in long-term recovery from alcoholism for 35 years. In 1982, when my parents needed to get me the medical treatment that I needed, they did not have to take out a home equity loan. So I was surprised what happened when my kids got into some trouble. I'd like to share just a few examples of the 7 insurance denials for the co-occurring disorders of addiction and mental illness. Stigma and fear have contributed greatly to this issue. I have never met a person that suffers from an addiction that chooses to live in pain and misery. In 2015, one of my sons was discharged from an outpatient program, despite recommendations from the clinical staff that he was mentally unstable and at high risk for relapse. He was so despondent that he attempted suicide 2 days later, after a 48-hour hospitalization. A judge ordered him to more intensive treatment for his safety. The insurance company refused to pay for the recommended inpatient care. We paid for all of his medical care and have lost all appeals for this particular hospitalization. In 2016, my other son was court-ordered into treatment after first responders intervened on his behalf. The insurance denied his care after 12 days of inpatient treatment. The clinical staff stated that he could not be recommended for discharge. I found many examples in the 374-page medical record that showed that he could not be sufficiently stabilized at a lower restrictive level of care, less restrictive level of care. My son is alive today because of the extended care that we paid for out of pocket. He had asthma when he was a child and frequently needed to be hospitalized. Not once was he ever denied the medical care that the doctors recommended, nor was he judged for not caring for his body or blamed for his illness. As recently as this week, he was in the hospital for a few days for a medical condition that is a direct result of his opioid use. But because it presented as a medical issue, there were no questions asked about all the care that was necessary and that he needed. My husband had double knee replacement this year. We did not have to pay for the surgery prior to admission for the hospital. The ambulance transport from the hospital to the orthopedic rehab was paid for, unlike when a patient is transferred from an emergency room to a psychiatric hospital. That is denied. One of our claims for $61,000 was never officially denied. It was kept in a pending status. Even with the assistance of a New Jersey senator's chief of staff and an advocate from our employer, it was never resolved. The last contact from our insurance carrier in May 2015 stated, "You will receive a response to your issues shortly." So even when you have access to care, there are still barriers to treatment. We have spent over $300,000 in the last 7 years for my son's medical treatment. We borrowed against our home, cashed out our college savings accounts, and withdrew money from our retirement fund to pay for their care. The process of filing appeals is a painstaking, time-consuming one. The medical necessity denials are not clearly defined. I have spent hundreds of hours writing letters, researching, copying, faxing, and still lost every appeal, and I'm an informed consumer. My insurance company directs me to the New Jersey Department of Banking and Insurance. However, they have no jurisdiction over self-funded employer-sponsored plans. I have to appeal to the U.S. Department of Labor for resolution. This is the first time that I'm continuing the fight, and the U.S. Department of Labor has had my appeal since March. I reached out to them and asked for an update, but never got a call back. I can't change the past and doubt that any of my insurance appeals will be resolved, but I will not be silent anymore. This is nothing to be ashamed of. My hope is that I can prevent other families from suffering the financial, physical, and emotional toll that my family has. I know that I'm one of the lucky ones. I represent many other parents who have lost their children to these illnesses. And the added stress of fighting for our rights as consumers is unconscionable and frankly fraudulent. Thank you for your time.
This is what I was talking about at the beginning of the hearing, is that we see this frustration at the state level when the state only is able to regulate 30% of the health insurance plans in our state. The other 70% are regulated by the United States Department of Labor, and the Congress has not given the Department of Labor the tools they need to be able to enforce the law and create penalties for companies that are not rightfully paying the benefits that you've paid premiums for over a long period of time. And we've changed the laws in New Jersey, as you know, pretty significantly, so that for those 30%, none of what has happened to you can happen anymore in New Jersey. No pre-clearance, no ability to do a medical necessity review for 6 months after the beginning of treatment. All those things have been changed, but only for 30% of the people in our state. And so that's why the recommendations we've made to give much more aggressive tools to the Department of Labor are so very, very important in this. And both Patrick and I thought that Roxanne's testimony today was extraordinarily important to make sure that everyone understands the importance of those recommendations, that they're not just a regulatory grab. They are something that really makes a huge difference. It can make a huge difference in the lives of people in terms of saving their lives and the quality of life of the family who has to spend $300,000 to be able to make sure they save their children. It's unconscionable. And that's why, to me, last week, listening to the testimony of a number of these insurance executives was, quite frankly, sickening. When they continue to tell me that everything is going great and they're making great progress. It's simply not true. And so we need to be more aggressive, and I'm confident we will be. And one of the things that I know about this president is that that type of conduct by anybody offends him deeply. And anybody who is, I'll put it the way he would put it, putting the screws to somebody like the way that you got it done to you is not something that he stands for. And so I'm confident you're going to have this president's support for those changes in the legislation. And I would love to meet a member of Congress who doesn't want to vote yes on that. I'll be sure to talk to as many of them who want to. So thank you for being here today. I appreciate it very, very much. Patrick, sure.
Real brief. I appreciate you putting the plug in for parityregistry.org, which you used, which anyone in this country can use who's listening to this program as a resource to how to file an appeal. But ultimately, I think the quicker route will be to get articulate, powerful advocates like yours, like you've just demonstrated, to come out and press these attorneys general in these states so that they can weigh in with the insurers within those given states that may have a number of complaints across their health plans. And so this is key. And I'll just finally say that insofar as Secretary Costa, he's wants to meet with us on an ongoing basis on this. So I'll make sure we try to expedite that final appeal that you have when I go see him in about 2 weeks.
Yeah, I got a feeling you'll get an answer. Just a sense I have. Thank you for being here. I next want to turn to Dr. Denny Carisse, who is the Chief Clinical Officer for the Recovery Centers of America. We thank you for being here and look forward to your testimony.
Thank you very much. I'm Denny Carisse, Chief Scientific Officer at Recovery Centers of America, or RCA. I'm also an adjunct clinical professor at the University of Pennsylvania School of Medicine. I want to thank you and the Commission for the opportunity to speak today. I've been in the field working in treatment research and to a lesser extent policy for 32 years. What got me started in the field was my own experience with addiction. Thank you. What got me started in the field was my own experience with addiction. It was the era of Studio 54 and freebase cocaine and Quaaludes, and what I learned pretty quickly over 4 or 5 years was that I was not one of those people who could use drugs and still function. So it became a massive problem for me. When I sought help, I was living on minimum wage, and I had no health insurance, and I went to an outpatient program, and they had a sliding scale, and I paid $3.50 for every group, and I paid $5 for every individual session. I didn't know. It was like decades later I realized they were funded by the block grant. I mean, I had reviewed block grants by then, you know, so it was amazing to me. So thank you. Thank you to the taxpayers, by the way. Thank you for the policymakers. You all helped me. You gave me the chance to get back on my feet. So thank you all. I started by going to community college, the only place that would take me. And 9 years later, still sober in recovery, I finished my PhD in clinical psychology and started a NIDA-funded postdoc at University of Pennsylvania. During my 17-year research career, I was an NIH, SAMHSA, and ONDCP-funded scientist. I developed evidence-based practices with NIDA and IAAA grants. I tracked drug use trends in 300 treatment programs across the country for ONDCP, and I implemented outcome studies measuring treatment success. I also did projects with the UNODC, and I helped start treatment systems in places like Egypt, Nigeria, Nairobi, Iran, Thailand, places that previously had no treatment because their government said we have no problem, right? In 2008, while my oldest stepson was in residential treatment for his substance use disorder, my other stepson, who was 11 months younger, died of a problem with alcohol and benzodiazepines. I'm still very close with my stepson who's in recovery today, and he wanted me to bring this picture for you of my stepson that drank one night like he always did, took some benzos one night like he always did, and was never woke up and was found by his 3- and 5-year-old nephews. Starting in 2010, I shifted from doing research to developing and directing clinical care, first at Phoenix House, a system of 100 great treatment programs, and then for CRC Health Group, which has 120 programs, serving more than 42,000 people a day. So I've had intimate experience with over 500 treatment programs in this country. And my now CEO, Brian O'Neill, called me to come help a startup called RCA. I chose RCA because it was a place like those treatment programs in those other countries where I could start from scratch. I could look at what does the science say is the best we have to offer, both psychosocial services and the medicines, everything that's available. And I could create what the science says is the best treatment, the best way to help people to get into recovery. I was employee number 8, and now we have over 1,000 employees, including sites in New Jersey. So I believe this set of experiences makes me uniquely qualified to make recommendations addressing what President Trump recently called the worst drug crisis in American history, because that's what it is. One of the projects I'm so proud to be part of is called Plan A. I think that Patrick Kennedy dubbed it Plan A to some extent because we realize there is no Plan B, you know? And a lot of it dovetails what you've done, but it wants to achieve 4 goals. Set national standards for high-quality treatment, expand and improve access for Americans, particularly in federal programs, expand treatment capacity, and facilitate compliance and enforcements of parity, all right? I'm particularly proud of this effort because RCA has invested time, money, resources, hired expert health litigation folks to fully develop these amendments. They're ready to implement, and if adopted, they will help all people suffering from this disease, and they will help all treatment programs. This is not an RCA bill. This is a national piece, and so it's not a bill. It's a series of amendments. So setting national standards for high-quality treatment. You know, we know that this is a disease. The field wants to be treated like every other medical health care provider. The field wants to be paid like every other medical health care provider. Incumbent upon that is the field needs to deliver care, document care, show success like every other medical provider, and we need to hold the field to those standards. So covered services under all the federal benefits programs have to be uniform and provided in accredited facilities. What happens when you do that is that you can mandate the use of best practices, not just a select couple of best practices and one-offs, but all the best practices that are out there, that they could offer everything. We do that with cancer patients. We offer them every possible avenue of treatment. Why don't we do that in one place for substance use disorders? It's also a way to demand, to define and measure success or keep score, as was brought up in the last meeting that you had. That this idea of that there's no gold standard of what success is has got to change. We've got to have a universal way to measure. It can also establish high-quality standards, not just for residential and outpatient, but for the continuum of care that we know is so important, the length of care that people get, and that it can be include sober living in a structured way, not kind of the wild, wild west of sober living, but a real clear, these are the standards for sober living, have it accredited, and get some really quality treatment. Standards could permit the treating physician to determine medical necessity for minimum periods of time at each level of care, and require federal benefits programs to cover all types of medication-assisted treatment, agonist, antagonist, partial agonist, et cetera, right? So by requiring programs to adopt scientifically derived standards and get meaningful accreditation, we greatly increase the likelihood of success in recovery, cut down on wasteful spending, and this constant cycle in and out of substandard care provided in inadequate doses, because that's what we do now. Okay? 2, expanding and improving access for Americans covered by federal programs. Many people in the country make a point to say to our veterans, thank you for your service. Thanks for your service. But when they get back, if they're lucky to get services, it can be really quality service, but it's tough for them to get those services. So what we want to do is make sure that the veterans can get the services that they need, that they don't have to wait a long time. Because what we know about this disease is that you have to wait a while. When you're ready to go in, you've got to get in right away. This is not a disease that somebody continues to have motivation to get helped with. This is a disease that takes over the brain. So if the nearest VA facility is 40, 50 miles away, or if the wait is an unusually long wait time, we want them to be able to be treated in civilian settings as well. For Medicaid patients, eliminate the IMD exclusion. I know you've already done a lot with that. 16 to 40 is a great kind of bump up, but the reality is that a treatment program at that size will not have the resources to have addiction doctors or to have psychiatrists full-time, which our patients so desperately need. So it'd be even better if we could eliminate it. For Medicare, we want to take care of our older adults and require that states and folks take care of older adults and everybody regardless of age. And for federal employees, we want to recover appropriate dosage and amounts of durations of treatment under all health plans. All right, very quickly. We want to expand treatment capacity. There's a couple ways to do this without allocating any new money, just basically prioritizing current funds to address this public health emergency. One way would be to designate geographic areas of severe distress. So areas where we have unusually high overdose and death rates, call them substance use disorder needs areas. And one way we could encourage investment in treatment is through preferential treatment under the new Markets Tax Credit Program. Another way we could do that is by encouraging investment designating these severe treatment needs areas, targeted employment areas for foreign investors, and expedited visa review under the EB-5 program. The money's already there. If we could allocate a special preference, that would help people invest in developing more treatment programs. Finally, we have to facilitate compliance and enforcement with the Parity Act. And one way to do this is to adopt a uniform kind of multi-step process that we set out for group health plans to document compliance with non-quantitative limits of parity, such as pre-authorization requirements and whatnot. And so this will allow the good guys to show that they're in compliance. And it could also allow sanctions for the folks who are not in compliance. It's 33 years since I started community college, and my passion for helping people who struggle with this disease has not diminished, nor is my commitment to my own recovery. All the homework, including the cost studies and everything, have been done for these amendments. They're ready to go. We've been shopping them around. Let's just get it right this time. I'm so thrilled that I'm here on the day that you're going to say what your recommendations are. We want to get it right with quality, proven effective services for everybody with this disease, because there's nothing I'd like more than to put myself out of business before I'm ready to retire. Thank you.
Thank you. Thank you for your passion, and we look forward to receiving the documents that you have regarding your amendments, so thank you for that.
Thank you.
Next, I want to turn to Doug Griffin. Doug is here today from Newton, New Hampshire. We are very, very happy that you were willing to share your time and your story with us today. Mr. Griffin, I turn the microphone over to you.
Thank you. First, let me say that I'm honored and humbled to be invited to address this commission charged with such an awesome responsibility. My name is Doug Griffin. I live in Newton, New Hampshire. I lost my precious daughter, Courtney, to an overdose of fentanyl on September 29, 2014. She was 20 years old at the time of her passing. I come today to represent the Addiction Policy Forum's families. My wife is here with me today. She is my rock and stands beside me in all that I do to fight this wave of destruction sweeping across our great land. Without her, I would never have been able to even attempt to begin the fight. At this point, we all know what a family faces when a loved one begins a life of substance misuse, so I want to focus today on what we face after we've lost the battle, and we must go on with broken hearts and broken dreams. My family's story begins on the plains of Kingston, New Hampshire on a cold November morning shortly after Courtney's passing. We stood and told a small crowd of maybe 200 about our struggle and urged the public to learn quickly of the dangers of drugs in our communities. Shortly after that rally, our pastor, Aaron Goodrow, began a monthly service in our small church for those touched by addiction. Aaron has held 23 funeral services over the past 4 years for those who have died from overdose. My wife and I co-host the event and make a dish to bring to the potluck dinner after each service. It's there that we comfort the moms and dads, the grandparents, siblings, and friends of those new to loss. We try to help them learn to manage their grief and begin life anew. At that service, we fill blessing bags. These are small backpack-type bags we fill with toiletries and personal care items. They are distributed to those that are forced to the streets by their addiction. I am a Lion. In 2014 was the year our Lions Club was chartered. My wife and I and our 2 daughters, Courtney and Shannon, also joined the club. Courtney cooked scrambled eggs for around 200 people in our annual fundraiser about a month before her passing. Lion Mike Dolan and I pushed for the formation of a Leo's Club in the Sanborn Regional High School shortly after Lion Courtney passed. Leo's are junior Lions aged 12 to 18. Last week, our 21st member signed on. The Leos helped to set up a local community center and are raising funds to help build a safe place for teens to gather. When asked what they wanted to do as a club, they replied that they wanted to push drugs out of their school. I believe that the only way to get them out is because if no one's buying them, there won't be any reason to have them in there. We are hoping our sports teams will be the first in the state to pledge to be drug-free. Then the cool kids will be helping to let the students know there's no place for drugs in our schools. I have been selected as the Leo chairperson by the New Hampshire Lions, so I travel to cities and towns encouraging them to start Leo's clubs in their school. The Kingston Lions Club has begun an annual golf tournament with the proceeds being donated to treatment facilities and organizations helping those with substance misuse disorder. Our funds become scholarships to help people into treatment and to begin to put them on the path of recovery. My family owns the Green Griffin, a local flower shop, and my daughter Shannon is the world's best florist. Don't take my word for it, you can just ask anyone. The flower shop is the place where people come to talk about their sons and daughters with substance misuse disorder. It's not uncommon to have 2 or 3 families a day in there who eventually get around to talking about their kids. I am the man at your door with flowers the morning after your son or daughter has died from an overdose. I know how these people feel. Excuse me. And there's no worse pain. My daughter is sought after to do these flowers for these victims, having lost her best friend and sister. She always takes time to make beautiful arrangements for these families to help ease their pain. It kills me to see a tear in her eye while she works. My dear friend Anne-Marie Zenfagna has painted up portraits of over 100 souls lost to overdose, and there is never a fee for her art. I have seen her portraits of her daughter Jackie and my daughter Courtney side by side in many events in New Hampshire. I am on the board of directors of the Merrimack Valley Prevention and Substance Abuse Project in Massachusetts. I am there so I can help erase the border between Massachusetts and New Hampshire. There are no borders in this fight. We work to raise awareness across the Merrimack Valley to fight for legislation to improve conditions for the residents of Massachusetts struggling with the substance misuse problem. I was contacted by the Addiction Policy Forum a couple of years ago, and since then I have worked gladly and closely with that amazing team of professionals whose goal it is to save lives. Through the storm of this epidemic, Jessica Nickel has pushed hard to find ways to help others with their struggle. Now with a reach of approximately 4 million, and with thousands of families under her wing, she pushes forward to build a nationwide network of souls committed to a common goal, the saving of lives and the finding of a cure for addiction. I work with families every day, and each person is different. There are different reasons people take drugs, but what I hear most often is that they take them to feel normal and to fit in. Mental health issues lead many people to drugs where treatment and proper medication could allow them to live a normal life. Our daughter begged for treatment and told us repeatedly that she couldn't live this way. Our insurance company denied her at every door. The pills she found so easily at school led to heroin and the destruction of her life. I hear people say that it's their choice and they deserve what they get. Recently, I had a professional call me. He had hurt himself playing flag football one Sunday afternoon with his pals. The doctor prescribed an opioid, and after following the instructions on the prescription, he found he needed more. He learned that he was now addicted to them and didn't want to lose his job and ruin his career. What could he do? I'm sure this has happened to thousands across America and across the globe. Should this man be shunned or incarcerated? Our jails and prisons are filled with citizens desperately seeking a $40 bag of what they absolutely must have. There is no consequence they fear. There is only a hole that has to be filled. Without proper treatment, there will be no end to their agony. If any of you think they are injecting heroin to party with their friends, you are wrong. They're dying in gas stations, bathrooms, at the wheel of the car, while driving with their children in the car seat behind them, and alone in secret places that they hide from the world. I would find my daughter Courtney curled in a ball on her closet floor, hiding from the world. I had planned to retire next year to spend some time on a riverbank somewhere fishing while playing with my grandchildren. Courtney won't be having any grandchildren or children. And I probably won't be fishing. I will most likely be working with the Addiction Policy Forum and continuing in their fight. Today, I come to speak for those seeking treatment in a world without availability, without insurance coverage, filled with stigma. I testify on behalf of those my friends raising their grandchildren after the loss of a son or daughter. I testify on behalf of the babies born addicted to heroin and their moms fighting to keep custody of them. I am here today to speak for the treatment providers constantly being squeezed for fewer and fewer insurance days for treatment. I am here for the lost, homeless men and women at winter's icy breath soon blow through the streets of Manchester, New Hampshire. As the holidays approach and you are making your lists of who's naughty and who's nice, I pray your children will be spared from this plague and that you never know what it's like to be me.
Mr. Griffin, thank you for your extraordinary testimony. And I can only tell you that for those of us who are sitting up here, that's why we're here too. And I can't thank you enough for putting a face and a voice and a spirit to the people that this epidemic takes and the people this epidemic leaves behind.
Thank you.
Thank you, sir, very, very much. Next, I want to turn to Jim Freund. Jim's from Ashburn, Virginia. We appreciate you being here, Jim, and taking the time to share your thoughts with us.
Thank you. Governor Christie, members of the commission, and invited guests, thank you for allowing my wife, Sybil, and me to be here today. We truly appreciate everything this commission is doing. This opioid epidemic has no boundaries, and I believe it is our nation's new 9/11. Our son Scott was a normal boy, growing up full of love, life for his family. When his brain started to misfire in 5th grade, not one doctor could really explain what was happening to Scott. Was it ADHD, bipolar, OCD, or something else? We tried everything. However, we never really found anything out. All the doctors did was start him on a journey of pill taking, which over time became an addiction to prescription painkillers. Scott's addiction changed his brain on psychological levels. It literally altered the way his brain worked by rewiring its fundamental structure. Addiction is a mental health issue, not a moral failing or a character flaw. We must end the stigma of addiction, as we are doing with HIV and cancer. During high school, we had to do an intervention for Scott, and we sent him to a wilderness program in the Utah desert. 9 months later, Scott then went into an aftercare transition center in Tucson, Arizona. 1 year later, Scott graduated from high school in a transition center. I remember to this day the wonderful graduation speech Scott gave, full of life, love, and appreciation to all those who had helped him. Scott was so appreciative of his recovery, he decided to become an on-site counselor, helping other youths who were suffering from addiction. Almost 3 years after Scott's intervention, Scott came home, and our family was back together again. We enjoyed doing things again, going on vacations, and just enjoying life as a family. 1 year later, or almost 4 years after his intervention, Scott took his own life on August 1st, 2010, just 2 days before his 21st birthday. He knew he was relapsing. It's crucial to realize and understand that relapse does not mean that the treatment has failed. It simply means the treatment plan needed to be readjusted. Our family is now exploring the possibility of opening a self-help, self-supported recovery home here in Northern Virginia. What this commission is doing in its final report to the President is readjusting our nation's response, focus, and solutions to this epidemic. In a letter Scott left behind, he wrote, I have not found one person who can help me out. He went on, I love you, Mom, Dad, and Ashley so much, and there's nothing you couldn't done better. I just can't stand being in my own mind. It's torture, and it hurts. And I've tried for years to get help, but nothing worked. Dad, if you can help other families from this torture I've been living with, it's you. It's now our life's mission to find solutions that will save other families from suffering like with Sybil, our daughter Ashley, and I will endure for the rest of our lives. This is why we are here today, to offer our support to this commission combating drug addiction. Our family is all in, and we want to help any way possible. We appreciate and thank all of you for what you have done, and your final report to the President has great recommendations and ideas. However, the real work is just beginning. We must educate, unite, and harness the power of the American people and the different groups and families that are out there fighting for solutions to this epidemic. Groups like the Office of National Drug Control Policy, Shatterproof, Fed Up, and the Addiction Policy Forum, just to name a few. The time is now that together all of us can make a difference and end this epidemic. Scott's
Good afternoon.
Good afternoon.
I'd like to start by offering our thoughts and prayers today with the people of New York City, some of the toughest, most resilient people on earth, in the wake of yesterday's cowardly terrorist attack. This attack underscores that the terrorist threat is real. As we defeat ISIS and affiliated groups abroad, we must be vigilant here in our country as they seek other ways to attack the homeland. Inspiring such attacks through hateful propaganda has always been part of ISIS and other terrorist strategy. This underscores the need for the most careful vetting of who enters our country. There are hundreds of active law enforcement investigations into foreign nationals suspected of engaging in terrorism, and we must vet those seeking entry to the United States thoroughly. Last night, just hours after the attack, 1 million New Yorkers, including families with their children, marched through the city for a Halloween parade. Their message was heard loud and clear. The American spirit will never be broken. Those who hope we will succumb to fear will never get what they want. And those who seek to divide us will only bring us closer together. In the midst of the attack, New York City's finest, our incredible police and first responders, rushed to the aid of their fellow citizens. They did their duty, they ran into danger so that others could run away to safety, and they performed like the heroes they were born to be. Specifically, Officer Ryan Nash, a 5-year veteran of the NYPD, was among the first to respond to the scene and fired the shot that stopped the attacker from continuing the violence. He's a hero, but that doesn't come as a surprise to most of his colleagues. He's already received 2 awards during his young career, one for excellent police duty and another for other police action. Yesterday, he earned something that could never be properly displayed by a ribbon or a medal. He earned the never-ending thanks of a grateful nation. The President has vowed to defend our country, protect our communities, and put the safety of Americans first. This is the oath he took as President, and that is his sacred pledge to the citizens of our country. And with that, I'll take your questions. John.
Sarah, in the hours, in fact the days after the horrific shooting in Las Vegas, the President repeatedly said, now is not the time to talk about policy, now is not the time to talk about politics, that's for another time, right now we need to mourn the dead. Yet this morning the President launched into a political argument with Senator Chuck Schumer on Twitter, literally hours after this incident yesterday. Why was he so quick to go the political route and point fingers at Chuck Schumer for the fact that this person was in the country at all?
Well, look, this wasn't about going the political route. This is something that, frankly, the President's been talking about for a long time. This isn't a new policy. This isn't a new position. This isn't a new conversation. The President has been talking about extreme vetting and the need for that for the purpose of protecting the citizens of this country since he was a candidate, long before he was ever President. This isn't a new argument, this isn't a new position, and this wasn't new for the President to speak about it. Cedar.
We heard today at about 11:30 this morning from the mayor and the governor of New York, who had said at that time that the President had yet to call. Has the President called his mayor, his governor? He's a New Yorker.
The President has spoken with both the mayor and the governor of New York. Now.
Sarah, why wasn't Uzbekistan on the travel ban list?
As we've outlined multiple times before, those are determinations made by several factors. In large part, Congress helped play a role in determining a lot of those factors in placing specific priorities on different countries, and that would be the reason that they weren't a part of that.
Calling for Uzbekistan to be put on the list?
Look, that may be something that's looked at, but that isn't something that we have called for at this time, but certainly haven't ruled it out.
I'm just curious why.
Look, I think again there are a lot of different criteria that we use to determine which countries should be on there, and they haven't been determined as one of the countries yet. But I'm not saying that that's been ruled out either. Jordan.
Thank you, Sarah. On Senator Schumer, can you tell us when is the last time he and the President spoke, and
more broadly, the president saying that he is responsible, at least in part, for this attack. Does the president still see him
Before
as someone?
Before you go any further, let me be really clear. The president has not blamed Senator Schumer and doesn't feel that the senator is responsible for the attack. We believe very strongly that the individual who carried out the attack is responsible and no one else. However, we do think that there are policies that could be put in place that help protect American citizens. We've been talking about those for a long time, and we continue to push and advocate for those policies.
Does the president still see Senator Schumer as someone he can work with?
I think we'd love to work with Senator Schumer to pass legislation on extreme vetting, and if he's willing to do that, we would absolutely welcome his support on it. John Decker.
Thanks a lot, Sarah. The president was asked a little bit earlier when he was meeting with his cabinet about the possibility of sending this terror suspect to the detention facility at Guantanamo Bay, Cuba, and he said he is indeed open to that. Does the president believe he has the authority as commander-in-chief to send this terror suspect to Gitmo? That's my first question. And my second question is about Gitmo. What advantages does the president see in sending this terror suspect to Guantanamo Bay, Cuba?
Look, the point he was making is that he supports or would support that, but he wasn't necessarily advocating for it, but he certainly would support it if he felt like that was the best move.
Are there advantages in terms of sending any terror suspect to Guantanamo?
That's a question I think we'd have to dive into deeper and certainly talk with the interagency process before answering that. Matthew.
Thanks, Sarah. The president said last night that he'd ordered DHS to step up, quote, our already extreme vetting. I'm wondering if you could tell us a little bit specifically about what extreme vetting entails and if there's any indication that it might have had an impact on preventing yesterday's attack.
Sure. Some of the specifics for extreme vetting would be enhancing the collection and review of biometric and biographical data, improving our intelligence streams, improved documentation requirements and verification, improving information sharing with partner nations and foreign law enforcement and intelligence services, and an overall heightened scrutiny and more thorough review procedures for CBP and other agencies that would play a role in that process. Major.
Sarah, separate from the Guantanamo Bay question, does the president believe this suspect should be classified as an enemy combatant?
I believe we would consider this person to be an enemy combatant, yes.
Would the president therefore instruct the Justice Department not to charge him in federal court and to therefore use the powers of enemy combatant and that status to treat him differently, not only in terms of interrogation, but prosecution?
I don't believe that determination has been made. I think that's something we'll wait till we get a little further into the process.
To not having him charged at all in federal court?
Again, I said we haven't made that determination, so I'm not going to speak to that yet until we've gotten...
You said you're open to the enemy combatant thing. You think he is an enemy?
I said we would consider him to be an enemy combatant, but in terms of how we would process, yes.
And on what basis?
I think the actions that he took certainly justify that.
Does the green card status in any way influence that determination?
Not that I'm aware of. Kristen.
Sarah, I want to follow up on the question that John was asking you earlier. You're making the case that these are not new policies he's talking about. And yet the question still remains. He is delving into a policy and political discussion. And he and you were very clear after the Las Vegas shooting that it wasn't appropriate to talk about policy. So what's the difference now?
I said it wasn't appropriate to politicize the conversation, which I don't believe we are. We're talking about protecting American lives, and there are things that this president has consistently and repeatedly talked about, advocated for, pushed for, introduced executive orders for, supported legislation for, time and time again since long before he was even president of the United States, that support this position. It's not a new position. There are facts that we know about this horrific tragedy that we know caused some of the things in this horrific tragedy that I think determine what those policy positions that he's been advocating for long before yesterday are very consistent with the activity that could have prevented something like this from happening.
The president invoked Chuck Schumer's name, so how can you argue that it's not a political argument that he's making?
Look, Senator Schumer has supported these opposing policies, and I think that that is very basic fact. Margaret.
It's not unifying the country. Is he failing to unify the country at this
He helped implement them on the front end long before the Gang of Eight. And the Gang of Eight would have only addressed one part of that problem, as we've talked about many times before. He may have helped isolate one part of the problem, but it would have exacerbated so many other parts of the problem that fall within our immigration system. If you only address one part and not in the totality of it and introduce a fully and more responsible immigration reform like the president has proposed, like the president has outlined, then you're not addressing the problem, you're not fixing the problem, you're only making things worse. Margaret.
Republicans have voted for it, Sarah.
Margaret.
When he's talking about quicker, greater punishment, is he just talking about better enforcement of laws that currently exist, or is he talking about some sort of extrajudicial process, and are you looking at doing an executive order that would empower him? Would he make something like that public, or would you consider doing a secret order? And very quickly, I also want to ask you, is he really serious about tying the Obamacare mandate stuff to the tax thing, or that seems like you would just blow the whole deal up, blow right through that Thanksgiving?
Very different questions. Let me try to address the first part in terms of, I believe he was voicing his frustration with the lengthy process that often comes with a case like this. So I think that was simply the point he was making. In terms of the mandate, we're focused on pushing through tax cuts and tax reforms separately. Obviously, we've never made it a secret that we'd like to repeal and replace Obamacare. We'd still like to do that, but we still think it's probably more likely to do something like that in the spring.
Sarah, Chuck Miller, the Deputy New York City Police Commissioner, said the suspect committed the attack in the name of ISIS. Governor Cuomo said the suspect was associated with ISIS. How can the president make the case that we are annihilating ISIS when an attack like this occurs? Are his policies emboldening the remnants of ISIS?
Not at all. We certainly, I don't think there's any way that you could discredit the progress that has been made on ISIS with a total defeat taking place in taking away their strongholds in both Raqqa and Mosul. But when that happens, as the president even said today, you have people that splinter off, go other places. Look, and we're meeting them in each of those places as much as possible, and we're going to continue to do that. It's another reason this president wants to institute extreme vetting to help keep more people out of our country that want to do us harm.
Thank you, Sarah.
Sorry, I was pointing at you.
The president said earlier, today starting the process of terminating the diversity lottery program. What did he mean by starting the process?
Just that we're going to continue pushing for and advocating for getting rid of this program. Something he's talked about. We'd like to see the lottery visa program not be part of any immigration system that we have in this country.
Okay, sorry, just to follow up on Margaret's question. So the president isn't considering any broader criminal justice reform?
As I said, we'll look at other specific ways to deal with it, but right now he was simply addressing his frustration with the lengthy process. John Gizzi.
Yeah, thank you, Sarah. A follow-up question on John Decker's question. The criterion that you listed for enhanced vetting sounds very much like that for a national ID card, a subject that comes up every few years in Congress, but which has never been acted on. Is the administration in favor of a national ID card as part of the enhanced vetting?
Look, we've laid out what our principles and our priorities are, and we'll work with Congress on determining the best way to make those specific pieces of legislation. But the things that I outlined are what we'd like to see, and whether or not what form that comes in, that's yet to be determined. But those are the principles we'd like to see take place in any extreme vetting program.
You're not ruling out a national ID card as part of the
right, but I'm also not saying that we're fully in. I'm saying that we've laid out the principles and the priorities that we'd like to see and that we think are important in an extreme vetting program. Blake?
Between the time the president sent the tweet out last night saying that he's called for a step up of extreme vetting until now, can you lay out exactly what has been stepped up in that time frame?
Look, I think he's taken a call to action. I know he's spoken several times with members of his national security team to look and see what specific things can be done. But we have put in place executive orders already since the president's taken office that help go as far as we can at this point.
Going forward on tax reform real quick, if I can, do you mind? It's possible that one of the things that Republicans are looking at right now is drastically lowering the cap for 401ks. The administration has consistently said that this tax plan has to help the middle class. So how would bringing down the cap on 401ks help the middle class?
Look, we're continuing to work with the House. I'm not going to negotiate, as I've said, I think every day this week with you guys here in the media. I'm going to let the economic team here at the White House work with members of both the House and Senate to put forth the best bill possible. We also are making sure that the priorities that we've laid out, including helping the middle class, are part of the final piece of legislation. We support where we are in the process right now, and we're going to continue working with both the House and Senate to make sure we get there. Amen.
Thanks, Sarah. On that tax cut bill, what does the president want that bill to be called? There are reports that he wants to call it the Cut, Cut, Cut Act. Was that correct?
Look, I think the president, if it's called the Cut bill, great. I think that the biggest priority that he has is making sure it does what he's laid out are his priorities in that piece of legislation. That's providing tax relief for middle class. It's making it more fair. It's making it more simple. Those are the things that he's mostly focused on. If it's called Cut, 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 and it includes massive tax cuts like this president is proposing, I think we'd perfectly be fine with that name.
If his Federal Reserve Chair pick is a man or a woman.
No, I cannot tell you that, but I can once again echo that it's not Major Garrett again today. Still consistent on mentioning poor Major. Go up here.
Sarah, the president talked about wanting merit-based immigration today, and then criticized the diversity visa program. Is he aware that the diversity visa program actually does have a merit-based component to it?
Look, there may be a component of it, but the fact that we have a lottery system that randomly decides who gets the greatest opportunity in the world, one of the best things that we have in this country is the fact that everybody wants to be here, and to give that away randomly, to have no vetting system, to have no way to determine who comes, why they're here, and if they want to contribute to society is a problem. And the president strongly supports making sure that the people that come here want to be here for the right reasons and not to bring harm to our country. And I don't think that's something that any American shouldn't want to support.
Jim? Are ranked by their job that they have had, and they have to have minimum education
Peter, the
requirements.
whole idea is that they are randomly selected. This isn't
criteria and having certain rankings.
It's the lowest level of criteria that any part of our immigration system has is through the lottery system. And so to try to argue that this is a system that thoroughly vets people is just shows a total lack of understanding for what this process is.
People have come in since the Uzbek gentleman yesterday came in. 350,000 people come to the country on this program. One of them now apparently has been accused of a terrorist act. One out of 350,000 create a problem then for that program?
There may be more. Look, all I know is that you can't randomly select people and not have them thoroughly vetted and not have the ability to know whether or not these people want to do good things or bad things when they get here. I don't think it's unreasonable to ask that people that want to come to this country go through a vetting process to make sure that when they get here, they want to contribute to society and not harm the people of this country.
Sure.
Jim.
Why did the president call the U.S. justice system a joke and a laughing stock during his comments in the debate?
That's not what he said.
He said that the system of justice in this country is a joke.
He said the process has people calling us a joke and calling us a laughing stock. Look, I think, as I told Margaret, he's simply pointing out his frustration of how long that this process takes, how costly this process is, and particularly for someone to be a known terrorist, that process shouldn't move faster. That's the point he's making. That's the frustration he has.
A separate subject, if I could, just other folks have a couple of questions each. Getting back to George Papadopoulos, does the president recall at that March 31st, 2016 meeting of his National Security Advisory Board, Mr. Papadopoulos suggesting a meeting between then candidate Trump and Vladimir Putin? Does he recall that?
No, I don't believe he does. April.
Sarah, two questions. First, Mary Frances Berry, the former head of the U.S. Commission on Civil Rights, says everyone wants better. But to stop people from coming because they come from different countries is totally wrong. What say you?
Nobody said because they come from a different country. I think that's the whole definition of immigration, is that they wouldn't be U.S. citizens. We certainly haven't said that immigration as a whole should be outlawed. So
the diversity lottery is specifically for those coming from other nations that you are not favoring right now because you believe that there is a possibility of terrorism.
I believe that we have a fundamental right to protect the people of this country, and if we see or think that someone is a threat to United States citizens, that we should take every precaution that we can to protect the people of this country. And I don't think most Americans would disagree with that. In fact, most Americans do support extreme vetting and certainly support the protection of the citizens of this country.
And second question, last question, compromise, the issue of compromise. What is the definition of compromise as it relates to slavery and the Civil War?
Look, I'm not going to get in and relitigate the Civil War. It's like I told you yesterday. I think I've addressed the concerns that a lot of people had and the questions that you had, and I'm not going to relitigate history here.
When you left, so, and I'm going to ask the question again.
Why don't you ask it in the way that you're apparently accusing me of being?
I'm not accusing. I'm asking a question, Sarah. Seriously, the question is: does this administration believe, does this president believe slavery was wrong? And before you answer, Mary Frances Berry, a historian, said in 1860 there was a compromise. The compromise was to have southern states keep slavery, but the Confederacy fired on Fort Sumter that caused the Civil War. And because of the Civil War, what happened? The North won.
I think it is disgusting and absurd to suggest that anyone inside of this building would support slavery. Peter.
Yesterday from that podium you said all of our leaders have flaws. Washington, Jefferson, Roosevelt, and Kennedy. What are President Trump's flaws?
Probably that he has to deal with you guys on a daily basis.
In fairness, he doesn't deal with us on a daily basis. So what would you say in sincerity?
Most every day, actually, he
What are
does.
his flaws then, I guess? Simple question.
Yeah, I just gave you one. Trey.
Thanks, Sarah. Two questions for you. What does the future of Guantanamo Bay look like under the Trump administration?
I don't have any announcements or changes or adjustments to policy at this point.
Follow up on last night, could you give us a little bit more of the tick-tock of how the president found out about this terror attack in New York City, how he immediately responded, who he got on the phone with right away, just trying to get a better understanding of where he was at this time, what he was doing, and what actions he took following the news?
The president was in the Oval Office when this took place, and he was first briefed by General Kelly shortly after it happened. I'm going to take one last question.
Sarah. Thank you, Sarah.
No, right here.
Thank you, Sarah. Will President President Trump look for enhancing anti-terror measures with other foreign countries during his visit to Asia? And also, will President Trump call the leaders of Argentina and Belgium to express his condolence?
I believe that arrangements are being made for him to speak with the leaders of those countries. They're working between the two teams to set that up. In terms of looking for conversations around anti-terrorism, that will certainly be discussed throughout the trip over the next several days. And as I said earlier this week, General McMaster will be here tomorrow to discuss the trip in more detail and certainly in more depth for the briefing tomorrow. Thanks so much and have a good day. We'll let you know later today what time that should be. But both will most likely take place in the afternoon. Thanks, guys.
Thank you, Sarah.
This is Steve Lookner with Right Side Broadcasting. That was the Sarah Sanders White House press briefing, and this is the White House press briefing post show here at Right Side Broadcasting Network. We want to hear your comments and hear what you thought of the press briefing. We're going to be talking about it now, going over what happened in the press briefing, but we really want to hear from you. So if you have any comments, any thoughts on what happened in the press briefing, give me a shout on Twitter at Lookner, at LOOKNER. Let me know. I'm going to read your comments on the air. Also, thank you for tuning in today. Thanks to the moderators in the chat rooms for moderating the chats. Thank you all for watching us today. And if you like our coverage, please consider donating to Right Side Broadcasting because we are viewer supported. Your donations keep us on the air and allow us to bring you an alternative to the mainstream media. So if you like our broadcasts, you can donate by going to the bottom of the YouTube chat and clicking on a little dollar sign. There's a little dollar sign at the bottom of the YouTube chat. You can click on that or go to rsbn.tv/donate, rsbn.tv/donate. So before getting to your comments, and again, write to me on Twitter @Lookner so I can read your comments on the air, I want to talk about interesting moment toward the end of the briefing. So, you know, I had the briefing on the TV here. I keep it on the TV before it's about to start and during it so I can watch it. And I had it on CNN today before the briefing just to keep an eye on it. And CNN was doing this story before the briefing where they were interviewing April Ryan about how at the end of the last briefing, she shouted at Sarah Sanders. When Sarah Sanders walks off, like a lot of people shout at her, shout stuff at her. And I know a number of you have written in and say, why do they shout stuff at her? She's not going to answer. But anyways, at the end of the last briefing, she shouted, April Ryan of CNN, does the White House support slavery? Or it was something like either does the White House support slavery or will the White House condone, denounce slavery? I think it was does the White House support slavery? Something like that. And they did this whole story, and I was just sitting there going like, oh my gosh, CNN's doing a story and interviewing her about this question that she asks, where there's no reason, I think, to think people in the White House support slavery, and to give her to do this whole segment on her shouting that question at Sarah Sanders as she walked away. But anyways, it actually came up again during the briefing because April Ryan asked the question to Sarah Sanders during the briefing. She literally asked Sarah Sanders, does the White House support slavery? And you know, it's weird to me because like I guess what the problem I have with that question is like, what has the White House really done to suggest to like a normal non-biased objective person that they would support slavery? Now, they did defend General Kelly's comments about the Civil War, but I don't think if you look at those comments about the Civil War, it's a plausible interpretation of those comments for reasons I explained last time to say that, oh, well, those comments suggest General Kelly supports slavery. Anyway, so again, I just feel like if you look at General Kelly's comments, they don't suggest, to me, to a neutral, unbiased observer trying to make the most plausible interpretation, they don't suggest to me that the White House supports slavery or that General Kelly supports slavery. But she asked it to Sarah Sanders in the briefing, and Sarah Sanders said, I actually just tweeted out about this before the briefing ended. She said, quote, I think it's disgusting and absurd to suggest that anyone inside of this building would support slavery. Anyways, that's one moment that stood out to me. There were some other moments. Sarah Sanders did say that she said that I believe we would consider this person the terrorist suspect who was arrested yesterday for the New York City terror attack. Sarah Sanders said, I believe the White House would consider this person to be an enemy combatant, which is this legal term talking about it's a term applied to certain people, you know, who are fighting against the U.S., and it allows for different legal proceedings to take place against them. So she said that the White House considers this person to be an enemy combatant. Anyways, we can talk more about that, but really want to hear what you have to say about this briefing. What did you think about the briefing? Did anything stand out to you? Write to me on Twitter @Lookner, @LOOKNER. I'm going to see if anybody wrote in yet. Patriot of Truth says, April Ryan's question was an insult to the White House, in my opinion. Ryan writes in, she handled April Ryan's stupid race-baiting question very well. Let's see here. Jenks writes in, they shout stuff at the end to try to get it on the air, and it goes back to the loaded question thing. Donald Mills writes, what a disgrace of a question asking if he supports slavery. Absurd. Always implying they're in the White House with white sheets on. Leona Galal says, I am disgusted that April asked if the president believed in slavery. Linda Belk says, I agree with Sanders. Some of these so-called journalists need to get a grip on reality. Sean Ellis says, I thought what April Ryan from CNN tried to do and does on a daily basis to try and tie Trump to racism and slavery is beyond disgusting. At Dingle says, nice question today, huh? Not leading at all. Does the president believe slavery was wrong? WTF. Now, and just to make sure, so I know that the question she asked yesterday, shouted, was I think it was about the White House. In today's, it sounds like today's, I might have remembered it wrong, was specifically about President Trump and not the White House. So I don't have the question in front of me. Let me just see if I can find it if I look it up from today. Because yesterday, I think she asked, does the White House support slavery or something to that effect? But let me see, did she ask specifically about the president today? So somebody, Amber Athy says, oh, the White House one was a couple days ago. Anyways, feel free to look it up, someone, and see if she asked. It's really, I just like to get the facts right. That's why I'm doing this. It's not really, it's not a big point whether she said today to the president or the White House. So, but anyways, let me continue reading your comments. So I apologize if I got that detail wrong. Proud American says, Sarah just gave the media a total KO. Doug Niples writes in, the Southerners could have accepted lower compensation for property or freed slaves in exchange for payments over time. And Doug Niples also says, surely April would have objected to the Crittenden Compromise, but the federal government paying more for slave freedom in the Southerns, and it tails off there. So it sounds like you're commenting, Doug, on the whole question of compromise in the Civil War. I haven't had time to go back and go over the Civil War compromise stuff, so I am not as fluent on that as I could be right now. But thank you for your comments. So I can't speak to the accuracy of any claims anyone makes about what compromises might have been available and were discussed at the time just before the Civil War. Dingwell says, I must know why doesn't the White House just ban reporter April Ryan? Bigots should not be allowed near the briefing room. Garrett says, the White House should invite some real reporters at the briefing. These guys are too biased to even be dog catcher. NG says, amen, another agenda the liberals like to play. Now, it's so funny. I tweeted out Sarah Sanders to CNN's April Ryan, I think, and I gave the quote, and somebody wrote me back on Twitter, April Ryan isn't CNN's White House correspondent, Dip S. I just watched April Ryan ask the question in the White House press briefing, so I don't know why what this comment is on Twitter anyways. I don't know. Bob See Your Uncle wrote in a joke. Bob See Your Uncle said, hey Steve, I like to not watch NASCAR. Does that make me a racist? Donald Mills says, but I guess if we think about it, as long as they keep playing identity politics with no message, we keep winning. #MAGA. Doug Niples says, in clarification, Kelly said failure to compromise, and he was correct. There was room for ending slavery via compromise/payments. Omar Gonzalez says, big government is slavery. Who supports big government? Answer Democrats. Democrats support slavery, not Trump. Redacted writes in, it's sad that President Trump's administration so clearly shows favoritism towards tragedies in place he likes are red. California, #wildfires. JC, one of our moderators, writes in, Steve, ha 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 ha. Sarah is so awesome, and what an epic mic drop she gave today. Go RSBN, #RSBN Mod Squad. Hi, Mom, he. Love you, Steve, Joe, and everyone at RSBN. Thank you to JC and all the other moderators today in the chat room on YouTube. We have JC and Jazz Punk and Barbara Brayley and Real Frank, and then we have Glenn O and Common Sense on the website. Roger Vega is also in the YouTube chat. And this is Right Side Broadcasting. Again, this is the post show for the White House press briefing. We're reading your comments about what you thought about the press briefing. People seem to want to talk about when April Ryan asked if the White House, or was it President Trump, I can't remember which one she asked, supported slavery or condoned slavery. And she said, in response, she said, I'm going to get the quote up here because I have it right here. I typed it out. She said, I think it's disgusting and absurd to suggest that anyone inside of this building would support slavery. That's what Sarah Sanders said. So a lot of you seem to want to talk about that. We'll talk about anything in the briefing. Write to me with your comments on Twitter at Lookner, at Lookner. Also, if you want to know when we're coming on the air with breaking news, like for example, we came on the air and covered the New York terror attack for several hours. If you want to know when we're coming on the air with breaking news, subscribe to us on YouTube. Click the notifications bell when you do. Also, you can follow us on Facebook at Right Side Broadcasting and on Twitter at RSB Network. And I am on Twitter at Lookner. I post about breaking news all the time. Oh, and don't forget, we are viewer supported. So if you enjoy our coverage and you enjoy seeing these post shows and coverage of breaking news, please consider making a donation, because it's your donations. That's what keeps us on the air. Even the small donations, really help us out. So please, if you want to donate, go to the bottom of the YouTube chat and click on the $ at the bottom of the YouTube chat, or go to rsbn.tv/donate, rsbn.tv/donate. By the way, my phone just rang. I've been getting these really annoying phone calls. Ooh, I have to do something. I have two things. I've been getting these really annoying phone calls because I guess because it's now open enrollment for the next 6 weeks to sign up for your next year's health plan if you get it on the individual market. And I keep getting these robocalls saying from this company that wants to probably sign you up for some weird health plan or get a commission from helping you. And it's a real voice, but it's a robocall, and they will not stop calling. And I'm guessing there's nothing I can do. And I know I can file a complaint, and I'll probably do that at some point. But I feel like for the next 6 weeks, I'm just going to keep getting these calls. And they're from California, maybe because I used to live in California. So it's driving me crazy. But I just made myself a note. I just wrote health plan. I wrote a little note for myself that says health plan, because I need to sign up for my health plan for next year. I think in my county, by the way, there's only one insurer, so I might not have a choice as to what plan to sign up for. Thank you, Pam Peacock, for the donation. Pam Peacock just made a donation. Very kind of you. Thank you so much, Pam. We will use that to help stay on the air. Okay, let me get to some more of your comments. And the person who wrote in, who I'm not going to read any of their comments because I think they're just being a joking troll. They wrote, "She doesn't work for CNN. I mean it plain and simple." Well, no, she is a contributor to CNN. They hired her. Yeah, so I mean, it's not. I'm not making things up here. They did hire. Look, on the Wikipedia page. See? Since in May 2000, where is it on CNN? In 2017, she joined CNN as a political analyst, so she does work for CNN. There you go. Okay, so enough about that. Now, I guess what the person is saying, well, they're not a full-time correspondent of CNN, but so I see, but in the same way, like Ana Navarro is on CNN all the time, so, and also, well, anyways, I see what the person is saying. They're saying they're not a full-time correspondent of CNN, and I said in my tweet, CNN's April Ryan. Okay, now I am seeing what the person is saying now about the tweet. I was attaching her to CNN because she is a political analyst and she's on all the time on CNN. So I associate her with CNN. Fair enough. Maybe I'll send out a tweet after about clarifying that. So I take it back that that complaint had no merit, because I see what the complaint is. All right, let's read some more of your comments. Sean Ellis says, why do you think the mainstream media thinks Trump is racist and daily pushes the racist narrative on a daily basis? Do you think it's genuine or not? Well, I leave it up to them. I mean, I'm not going to get into their heads and say, why did they push this? I mean, you know, it goes back to the campaign. You know, like even in the campaign, when President Trump would suggest tighter immigration controls, some people would interpret that as saying he's racist against, well, racist isn't the right word. He's, you know, bigoted against Muslims. Whereas other people might say, well, no, he's not bigoted against Muslims. He's just saying that he believes that you have more, and that you have more terrorists coming from Muslim countries, so it just makes us more safe to have this kind of ban. So I think there are things that the administration does which can be interpreted different ways. Now, whether I don't know, is, you know, to the degree the media isn't interpreting it this way, or does the media raise these questions because they think it's good ratings? I don't know about that. You know, in the same way, if Jeff Sessions says, look, I want the drug laws to be enforced as they are on the books, and on the books they're strict, so I don't want, you know, restricted prison sentences for drug offenders if the laws on the books say that they should get the sentences X, and we shouldn't be giving them sentences Y, which are less. Now, some people might say, well, he's really doing that because he doesn't like black people, and black people get sentenced more for drug laws. That's why he's really doing it. Other people might say, well, no, the reason why he's doing it is the reason he says he's doing it is that he thinks laws that are on the books should be enforced, and that if we want to change the sentencing, we should actually pass different laws. So again, there are a number of policies that come up in a presidential administration where and in this administration, there have been a number of them where someone could look at it one way and someone could look at it another way. And I think there have been a number of those in the Trump administration. So that's a reason that some people, I think, say the administration is racist, is they look at these policies one way, but some people look at the policies another way and say, this is why they're doing it. Deplorable Corey says, this biased media and race baiting is getting really old, really old, and the majority of Americans are sick of it. Hasn't mainstream media figured out we aren't this stupid? DJ says, of course I'm a troll if I don't agree with all this racism in the hearing. I said nothing about that, DJ. I said nothing about, you didn't even I had no idea what you think of the hearing. You never even messaged me about that. Steamy Raimon says, not only legal, but common for those, what is this? I think this might be a reply to a different, that was an earlier tweet. Donald Mills says, I think the question that April Ryan asked today was, does the president either condone slavery or support slavery or something like that, or accept slavery? She says, Donald says he thinks the word today was president. Yesterday it was White House. Doug Neipel says, the questions about Gitmo were interesting. Enemy combatant charges subject NYC terrorists to different rules, correct? Yeah, so if you're an enemy combatant, I believe there are different justice policies that apply to you and how you can be tried and what your rights are and those kind of things. I'm not familiar exactly with what that is. Also, yeah, there were some questions that came up about let me show you. President Trump made a comment this morning where he said he would consider sending the combatant to Gitmo, the terrorist to Gitmo. And I'm going to show you President Trump's, let me show you his Twitter feed for a second. By the way, I need about 15 seconds here. Give me 15 seconds. Let me just let me get this on the screen real quick. Give me 15 seconds, guys. I'll be right back. Sorry, folks. I think you might have heard somebody kept knocking on the door, so that's done. My apologies. So let me show you the stuff that we were talking about before. So President Trump was asked about this morning, and he said he would consider sending the NYC terror suspect to Gitmo. And there was some debate about this because he didn't clarify why that would actually happen. I think there are questions about, like, legally to be sent to Gitmo. There's some certain classification the person would have to fall under. Maybe it's enemy combatant. I don't know. I haven't done enough research on this. But there was a question about that a couple questions in the briefing, I think. And let me see what I wrote down. So the press secretary said, I believe we would consider this person to be an enemy combatant. I don't know if that alone allows them to be sent to Gitmo. She said, Secretary Sanders said the president could support sending the terror suspect to Gitmo, but wasn't necessarily advocating for it. So she was saying that the president wasn't saying the suspect should be sent to Gitmo. She was saying that she said that the president would consider it, but wasn't necessarily saying that's what should happen. That's also something I need to, look up more about Gitmo in terms of, I'm not familiar off the top of my head with, who exactly can be sent there and under what exact conditions and what that all entails. I'll have to do some research on that. I'm looking up some things now, but I don't have that off the top of my head. So anyways, but that did come up. Feel free to write in more about that if you'd like. I'm going to get some more of your comments here. John Stanton says, Steve, do you really not know why they pushed the race card against Trump? John, if you have opinions on it, feel free to write in. Let's see. Fit to be Tied says you should download Blacklist Plus for your cell phone and block unwanted callers. If they call back, your phone won't even ring or register the call. I think the issue with these robocalls I'm getting about health insurance during the open enrollment period is that I believe they switch up the number they call from. So if you block one number, they call from another number. I don't think it's the same number every time. It's always 323, but I believe it's different numbers. So if I see it's the same number, I'll just block the number. But super annoying. I'm sure I'm not the only one in the country having this happen. I'm sure there are lots of people getting these robocalls. Okay, so Dingle sent me the quote from today, and Dingle sent me, April Ryan said, does this president think slavery is wrong? So she said both the administration and the president, and she said, does it think that slavery is wrong? And that was according to Dingle, that's the exact quote. Thank you, Dingle. Claudia writes in, CNN is absolutely unwatchable, no longer a source of news, just a platform of hate and propaganda. DJ writes in, you called me a troll because I agree with April Ryan. There's a lot of racism and racists in the White House. Well, no, DJ, when I called you a troll, what I was saying is, I thought it seemed like you were just writing in and not addressing what I was saying. So that's why I was saying that. To me, a troll is somebody who's just intentionally writing in to get in to bother people or disagree with them. But as I said afterwards, I think I saw after what you might have been getting at with the CNN comment about her working for them or not working for them or partially working for them. However, I will say this. So you think there's a lot of racism and racists in the White House? Happy to read your comment on the air. We do not censor comments here. We only censor comments here if they're like, offensive or like, very dirty, that kind of thing. So we are open here. I read what people send me. What people send me. You're watching Right Side Broadcasting's post show for the White House press briefing. Andrew C. sent me an email. Andrew C. says, I'm glad you mentioned something about these questions mainstream media ask Sarah Sanders. The one about slavery and the government wanting to restrict immigration, whether the government... All right, hold on. Let me take a step back here. I'm glad you mentioned something about these questions mainstream media asked Sarah Sanders. The one about slavery and the government wanting to restrict immigration, whether the government restricts immigration for religion, specific nations, and rids the USA of these nonsense diversity visas and other Democrat policies, which only supports liberal socialists' open borders policies. Immigration can and should be restricted to people who want to be here, can support themselves without any government assistance, and they can add value and skill to American society. Lastly, Democrats started the Civil War, supported slavery, racism, and bigotry, and they continue it today as liberal Democrats, socialists spreading their hatred, bigoted, race baiting, and other destructive racist policies. Liberal Dems are the only ones constantly bringing up race, creed, color, racism, big government, and the liberals are always trying to use tragedies and despicable history to further their agenda today. Thank you, Andrew C. That is a message from Andrew C. Thanks for writing in. And Andrew brought up the diversity visas. So when I showed you President Trump's page, I wanted to show you this. So this was asked about in the briefing. President Trump this morning sent out a couple tweets. And one of them was this one: the terrorist came into our country through what is called a diversity visa lottery program, a Chuck Schumer beauty. I want merit-based. And we are fighting hard for merit-based immigration, no more democratic lottery systems. We must get much tougher and smarter. And then he posted a quote, Senator Chuck Schumer helping to import Europe's problem, said Colonel Tony Schaefer. We will stop this craziness. So after posting these tweets, the president, there were questions, there was at least one question in, I think maybe a couple in the briefing about the President Schumer relationship, because President Trump, President Trump did say in one of his tweets, as I just showed you, that the terrorist came into our country on this diversity lottery program, a Chuck Schumer beauty. So Chuck Schumer was one of the people who voted for the diversity visa lottery program when it came in. And I read something about this earlier. So the diversity, I just want to clarify a little bit here. The diversity visa lottery, it's a lottery where 50,000 people a year get to come to the country from countries that don't have that much immigration otherwise to here. And it's a lottery in the sense of they have to go through a vetting process that shows it's safe to let them into the country. That's the idea of the vetting process, but it doesn't distinguish between any kind of like job skills they have and that kind of stuff. The vetting process really just handles safety related matters and not whether they might have certain job skills or how good their language skills are, that kind of stuff. And President Trump is saying he wants, and rather than having this diversity visa lottery, he wants it to be where we don't have that and instead have more increased merit-based visas where we're granting to people who say are workers with skills that we need workers for in this country, that kind of thing. But I want to show you the thing about the Chuck Schumer. I think it was that he was one of the people who supported it and then had some role in creating it. But let me see if I can find this here. There was one article I saw about this, and I'm calling it up here. Here it is. So this is a CNN article. Why can't I rearrange this, by the way? There we go. Oh, CNN's doing autoplay video again. There we go. So how did it get started? The program was established in a bill passed in 1990, the Immigration Act. Senate Minority Leader Chuck Schumer, then a New York congressman, was one of the 31 co-sponsors of the House version of the bill. Schumer was credited with the concept of giving visas to countries with low admission rates to the U.S., which he developed in a different bill that he sponsored that was rolled into the broader law. So So in theory, it says CNN says Schumer was credited with this diversity visa lottery idea. But at the same time, in the briefing today, Sarah Sanders did say, she said the president was not saying, she said the president is not saying that it was Schumer's fault that this terrorist attack happened. So she definitely was explicit about that. She said the president is not blaming Chuck Schumer. She said the president does not think Schumer is responsible for the attack. And there were some questions in the briefing too, where some people were saying like, hey, the president, is it appropriate for him to be talking about like, policy so soon after the attack, and is that politicizing the attack? And she said, I think I remember Sarah Sanders saying something like, well, he's talking about policy, but he's not politicizing it. Anyways, so that's a little bit about that Schumer stuff that was asked about. But if you have any more comments about the briefing, give me a shout on Twitter at Lookner, at LOOKNER. I will read your messages on the air. Garrett says Trump talked about chain immigration. The Uzbek terrorist seems to have brought 23 family members into the USA. Is that true? So I had read, this was a comment President Trump said this morning. So let me just get that comment up here so I can show you. Can I find that quote? Yes, this is from the Washington Post article. It says, referring to Saipov as an animal, Trump said the 29-year-old was responsible for the entry of 23 immigrants, many of them family members. The president said this chain immigration endangers national security. And then the president said that man that came in, or whatever you want to call him, brought in with him other people and was the primary point of contact for, and this is preliminarily 23 people that came in or potentially came in with him. Trump said that's not acceptable. Now, I'd read an article that talked about this quote, and the article I read said, there's no confirmation of this. So I haven't seen any confirmation that that the Saipov was responsible for 23 other people coming in. I did see a report that said he was a point of contact for some people coming in the country, but I don't, and I'm guessing President Trump is referring to that when he says primary point of contact for, but I don't, the 23 number I hadn't seen a confirmation of, so I can't really confirm that. And let me look up the point of contact thing, see if I can find that. Here's something from ABC News. The autoplays video is going to start, isn't it? Oh, it's not starting. Oh, now I have to stop it. Sorry. Here we go. Saipov was listed as a point of contact for two men who were listed in the Department of Homeland Security counterterrorism database and later overstayed their tourist visas, one federal official told ABC News. One was merely flagged after arriving from a so-called threat country, while the other vanished and was being actively sought by federal agents as a suspected terrorist. So there were a couple of people who came into the country, one of them considered a suspected terrorist who Saipov was a point of contact for. I haven't heard anything about this 23 number being confirmed about him. Now, if you are in the country, it can help get family members in the country, but I don't know anything more about the Saipov situation that the president referenced. DJ writes in, there's a lot of racism in this country being disguised as patriotism, selective outrage from the White House. And as I mentioned before, somebody had asked before about why do these reporters, why are they accusing the White House of racism? And as I said, then I do think, there are policies the White House takes views on, and some people look at them one way and some people look at them another way. And I gave a couple examples, but some people say, oh, they're doing this policy to keep America safe or to enforce the laws, whereas other people say they're doing this because it's racist. I mean, the travel ban is a great example of that, President Trump's travel ban attempts, whereas President Trump and the administration says we are doing these travel bans to keep America safe, and a lot of people agree with them, but other people, there are plenty of other people who say no, this is a disguised Muslim ban, and that's why we've seen like there was a judge who thought it was a disguised Muslim ban, and there have been judges who thought that, and they struck down the ban. So there's a lot of disagreement about how to interpret what the White House does out there in America. We've heard people say both things on this show, and I know it's out there. Senator Flack, David Obst writes, and Senator Flack said today that the Schemmer did away with diversity visa. He knows because he was there. Do you mean the Schemmer? Do you mean Schumer, David? And what do you mean by did away with the diversity visa? So I just read that CNN story which said he's considered to be the person who came up with the idea of it. He didn't pass the bill himself that had it in there, but feel free to clarify, David. DJ also writes, and I'm stating there is a racial divide and disparity in treatment, and people of color are being blamed for it because we speak out about it. GSB.UK says, Democrats call everyone racist. It's their MO. You put the mainstream media to shame, Steve. You show them how news should be reported. Great work. We just try to be factual here. And then we try to just read your comments. You know, we don't want to censor people. So give you a voice to say what you want as long as it's clean. Dingle writes, and surprised April Ryan doesn't just ask, does this administration, this president want to bring back the slave trade? She's simply ridiculous. John Yastishak says, yesterday April went from NFL players being angry to White House condoned slavery. That is just ridiculous. DJ says, Fox News is actually unwatchable and full of racist rhetoric. Martin Higai says, good job. Bob See Your Uncle says, come on, Steve, we have more important things to talk about, like the Dodgers, baby. There is a Game 7 tonight in the World Series for you baseball fans. Regarding the Sarah Sanders comment, response to April Ryan, Jerry writes, shame Sanders had the facts wrong and it was easy to verify. Does truth matter? I'm not sure exactly what facts Jerry is referring to. I just don't know. I can't tell from the tweet. Zhank says, the ones who say that the travel ban is disguised as a Muslim ban want all religion out of stuff. It's odd they would support a religion. Lieutenant Dan says, I think anything we like or watch or events we attend makes us racist. My brother's wife is black and he's a racist and has mixed kids. Okay, just let me look at my notes and see if there's any other things I want to talk about the press briefing. You're watching Right Side Broadcasting's post-show for the White House press briefing. To know when we're coming on the air to do more videos, breaking news, we come on all the time. Subscribe to us on YouTube and click the notifications bell. Also, we are viewer supported, so if you like our coverage, you like seeing an alternative to the mainstream media, please consider donating. You can donate by going to the bottom of the YouTube chat and clicking on the $ at the bottom of the YouTube chat. And also you can go to rsbn.tv/donate, rsbn.tv/donate. Apologies again for the brief interruption today in the post show. As I've mentioned, we're moving into a new studio here. We've just moved into we have Studio B in Atlanta. Still making some fixes. Almost all the fixes are done and setting up, but there's still some stuff being delivered. So some stuff got delivered earlier and needed to just grab that when it came. Unfortunately, I can't control when they're coming. So my apologies for that. Oh, another thing that came up in the briefing is there were some tweets this morning complaining that the president hadn't spoken with the mayor and governor of New York, and Sarah Sanders was asked about that, and she said he has spoken with both the mayor and governor of New York. Well, the mayor of New York City and the governor of New York State. Okay, so David Opp says Senator Flack says Schumer was responsible in some way for ending the diversity visa, but there still are diversity. Wait, as far as I'm aware, there still are diversity visas. That's still that program is still going. Yeah, it's, I mean, I'm just looking at a CNN article right here where it talks about how the program is still in effect. DJ says, so I ask you this, why did the Vegas shooter not receive as much criticism as this, and why do spree shooters continue to get a pass? Yours, I guess my question would be, what's the criticism you're talking about? Because President Trump did speak out about the Vegas shooting, or are you talking about the White House? Are you talking about President Trump, or are you talking about the press in general? If you're talking about President Trump, he did speak out against the Vegas shooting. Maybe the point you're saying is you think the kind of criticism the Vegas shooter is getting is less or different than the terrorist is getting. Now, the White House might say, or someone might say in response, well, that was, the Vegas shooter has not been shown to be a terrorist yet. He's certainly a deranged individual, but there hasn't been any motive found for that. So perhaps the president's response is tailored to any kind of terrorism, not necessarily a race kind of thing. But I can't be sure about that. I can't speak for the White House. John Stanton says, they ignore the facts to build a smear that will tamp down the black vote for candidates other than the Dems. David Ops, so you're saying I agree, but Flack says no. Did Senator Flack really, I don't think that Senator Flack really said that that the diversity visa lottery program had ended. Maybe he misspoke or something like that. Maybe it was reported wrong. Okay, I think at this point we are going to wrap up this stream, but I really appreciate all of your comments and writing in. A lot of people had thoughts about the briefing today, so very much appreciate you sharing your thoughts. We will keep an eye on breaking news, and if there's breaking news later today or this evening, we will definitely come on the air and cover it. So be sure to subscribe to us on YouTube. Click the notifications bell when you do. Also, you can follow us at Right Side Broadcasting on Facebook, and on Twitter, we're at RSB Network. I am on Twitter at Lookner. Thank you, Joe and Jake Seals, for excellent producing. Joe is on Twitter at Joe Seals. S-E-A-L-E-S. Jacob Seals is on Twitter at Jacob RSBN Music. Jude Seals, the head moderator, is on Twitter at RSBN Moderator. And thanks again to all the moderators in our chat rooms today. And in YouTube, I see Barbara Braley right now, and JC, and Jazz Punk, and Roger Vega, and Real Frank. So thank all of you moderators. And thank you for all watching. For all of you for watching, and thank you for the donations people made. Those are what keep us on the air, so we really appreciate that. If you like our programming and you want to donate and help keep Right Side on the air to cover more news, you can go to the bottom of the YouTube chat on any of our broadcasts and click on the $sign at the bottom of the YouTube chat. If you click on the $sign, you will be able to donate. So thank you. And also, if you go to you can also go to rsbn.tv/donate, rsbn.tv/donate. And if you want to there, you can even set up a monthly donation to get free stuff in return, like this Right Side mug. And I should do one more. I kind of like to do a news check before we get off the air to make sure nothing crazy has happened while we've been on the air. I think we're covered here. Okay, so thank you everybody. Thank you for saying thanks in the chat room. We have Sharon, we have Real Frank saying thanks, Susan Reynolds, Karen Infidel, let's see here. and everybody else in the chat room, Real Frank. Oh, was there another presidential tweet? JC just messaged me and said there was another tweet while we've been on the air. The president tweeted out a few tweets. So before we get off the air, let's read these tweets. The president tweeted out, we mourn the horrifying terrorist attack in NYC. All of America is praying for and grieving for the families who lost their precious loved ones. Just 11 minutes ago, he said, just spoke with Governor Cuomo and Mayor de Blasio to let them know that the federal government fully supports any and all of their efforts with respect to the West Side attack. Hashtag NYC Strong. Thank you, JC, for the update about that. Yes, and thank you everybody who wrote in again. Thank you, DJ, for writing in. So I appreciate you writing in, giving some different opinions. Always appreciated. Sorry for the I had a bit of a misinterpretation of your initial messages. So I think we've cleared. I'll post a tweet about that in response after. But thank you everybody for writing in with all of your contributions. And we will see you later on, be it later this afternoon, tonight, tomorrow, with more breaking news coverage. But for now, I am Steve Lookner. I am, Karen, who said this? Jan Wood says, like the black shirt and blue tie. This tie, I like the tie. It's a little, I'm getting a little light reflection off of it though. So I wish it, I have to adjust the lighting or adjust the tie or something, but I'll deal with that later. Anyways, thank you all for watching. Thank you for joining us. Thank you, moderators. Thank you, donors. Thank you, Joe and Jake Seals, for producing. And that's it for now. Have a great rest of your day, and we will see you soon here at Right Side Broadcast.